All right. Good morning. Good morning. Good morning. Yep, my mic is live. Okay. All right. Good morning, guys. Anybody have any questions on what you read? Any questions? You had 5 and 6. 5 was on dementia. You'll have a lot of dementia patients throughout your career. People are living longer. And a lot of people in long-term care are there because they can't take care of themselves. Some of that is physical, some of that is cognitive. So you will have a lot of dementia patients, to care for. One of the things that we need to understand about dementia is that if they're asking the same question over and over and over again, it's because your answer is not penetrating. Their short-term memory is offline. They're not able to lock in their brain what you're telling them. So instead of getting frustrated with them, the best course of action is to get them involved in something so they don't fixate on that question. One of the things that I like to do with, let me go through this real quick. Imagine for just imagine for a second that nobody needed you for anything. Right? For most of us, that would be like a great day, right? It's all us. Nobody needs you. Nobody needs you to cook, to clean, to answer the phones, to provide emotional support or physical support. You don't have to go to work. I mean, nobody needs you at all for anything. Now, for you, that would be a day off. However, if nobody needed you for anything ever again, your life would become pretty boring. You would start to feel like maybe you didn't matter anymore, like you weren't contributing. Does that make sense? Okay. So that's not how most people want to live out the rest of their days, feeling like they're a burden and they're not contributing. And this can impact how they relate to you. It can cause depression. It can cause withdrawal. It can also cause agitation. And that's kind of hard to get past, is if your patient is agitated just because they feel like they're not really needed anymore. So with a lot of older people, we give them tasks to do that are repetitive and within their level of ability, physical ability, not because we're trying to put them to work, but because we don't want those feelings of being a burden. So when we have dementia patients, a lot of times we'll throw some washcloths out on the table and have our, have them fold the washcloths. It's not, they're not folding washcloths for us. It's to give them a sense of community, a feeling that they're being productive. Matching socks is another one that is often done. And this is usually done with the older women, because think about the role of the woman in the home at the time that she was in the home, right? They cooked, they cleaned, they cared for the children. So doing common domestic tasks like that can actually lead to a feeling of well-being in your older dementia women. Now, men, this isn't going to do much for them. So with men are much more tactile. And with men, one of the things that I used to do is I had a little shoe box, one of those clear plastic shoe boxes, and I filled it up with raw rice, usually jasmine rice because it has a really good smell. And in there, I would put marbles or I'd put nuts and bolts in the rice. And then I could ask a man that was particularly agitated, can you find the marbles for me in this box? Or I need the nuts and bolts out of this box. Can you pull them out for me? And it gives them a task, makes them feel like they're being productive, that they're helping, but it gives them something else to fixate on if they're agitated. So these common household type tasks are helpful in redirecting patients. Another one that I used to use with female patients quite a bit is magazines kind of are going away. They just aren't being produced the way they used to be. But it was very, very common back in, the 40s, 50s, 60s to have these, maybe not the 40s because we were at war, but to have magazines delivered to the house. And the woman would just, flip through the magazines. It's a very common cultural identity. So in most housekeeping type magazines, there will be an ad, a full page color ad for Snuggle fabric softener. And I really like Snuggle because it has a teddy bear. Teddy bears are usually non-threatening and easily identifiable. So a lot of times with an older woman that was agitated or saying, I want to go home, and that's very common, I want to go home, hand them a magazine and ask, there's a teddy bear in here. Can you find the teddy bear for me? I need that teddy bear. And a lot of times they'll flip through the magazine. You may have to remind them what they're looking for. But again, it's refocusing their attention on something that's non-threatening to overcome that agitation. If you just try to tell somebody, you need to calm down. In the history of ever, no one has calmed down by being told to calm down. I don't know why people continue to do this. It doesn't work. And it definitely doesn't work with dementia patients. So don't tell somebody to calm down. It's your job to redirect. Does that make sense? Good. So these are some tools that you can use when you're working with dementia patients. But the biggest thing to remember is they may not remember what you just told them because their memory making factory is offline that particular time. So don't say things like, I just told you that. Don't you remember? No. If they remembered, they wouldn't be asking. They're not a 7-year-old that's repeating something to get under your skin. And that's a lot of times how we look at them. 7-year-olds do that as a way of exerting control, influencing the actions of somebody else. It's all about learning how to communicate and relate to other humans. And, 6, 7-year-olds go through this. And it's part of their developmental milestones. Drives parents crazy, but it's part of their developmental milestones. That's not what's happening with dementia patients. They're literally asking the same question because they don't remember. And you have to understand the dynamics there. Totally different dynamic, the why behind it. Does that make sense? Is that good? So working with dementia patients can be very, very challenging, but it can also be very, very rewarding as well once you establish a connection and you're able to relate to them. So chapters 5 and 6, 6 was on skills. Positioning was in chapter 6. So let's talk about that really quickly. So you will need to know positions. Usually there's one question on the state exam, not always, but usually there's one question on the state exam about positioning. Supine is on your spine. It's a great way to remember it. Supine is on your spine. Prone is posterior up. So you're on your stomach. So supine is on your side, on your spine. Prone is posterior up. Lateral is laying on your side. Now, left lateral would be laying on the left side. Right lateral is laying on the right side. But your body is pretty straight for the most part. You're just laying on your side. If you draw that, if you are on your left side specifically, and you draw that left leg up, I'm sorry, your right side specifically, and you draw that left leg up, so top knee is up. This is the suppository position, also known as the Sims position. Okay, so you're laying on your right side with that left knee up. It's also a very common sleeping position. A lot of people sleep in this position, kind of on their side with one leg cocked up. And a common mattress brand is Sims. So Sims is the sleeping position. So lots of ways to remember these particular positions. Fowler's is a very unique one, and it's kind of hard to remember Fowler's, but Fowler's is a sitting up position. So you guys are all in a Fowler's position right now. You're sitting up. Semi-Fowler's is slightly reclined, just, up a little bit, like halfway. So Fowler's and semi-Fowler's are probably the most common position that CNAs are going to have to know, because the patient must be in a Fowler's position for mouth care or for eating. Good. So the way I remembered that when I was in nursing school, this is kind of complex, or, just kind of go with me here. Another name for chicken is fowl. Anybody ever hear that? Another name for chicken is fowl, F-O-W-L. Well, if you're going to eat chicken, you have to be in a Fowler's position, sitting up. So that's a kind of a unique way to remember that one. If you know that chicken used to be called fowl, fish and fowl, if you can remember that, you can remember that Fowler's is sitting up, so you have to sit up to eat chicken. So those are the things that I really needed you to know out of chapters 5 and 6. Any questions on that? Any questions? All right, let me go ahead and get your scores. Candy, for both. Tyler? Josuel? For both. Sonia?
0 and 2.
Thank you. Amaris? 0 and 1. Thank you. Do you have chapter 4 for me by any chance? Thank you. Elena? Claudia? 1 and 0. Thank you. And Alyssa? 0 and 1. Thank you. All right. Those of you that missed something, do you know why you missed it? Do you need me to go over any of the questions with you? Go ahead.
The positions on chapter 6 test, the question 2 said something about laying on the left side with the bent knee. It was, I guess it's switched, it's lateral if you're on your right.
No, lateral is straight, just on your side, Sims is laying on one side with the bent knee. Sims is all about that leg being cocked up. Okay. Good. All right. Class is half over. Can you believe it? We're half done. It's only 3 classes after today. That's it. So if you've not registered for the test yet, you probably want to make that a priority, because remember, it's going to take, 3 to 4 weeks from the time that you register until you're testing. It's not instantaneous. The whole process takes time. So if you register now, you should be testing about a week or 2 after graduation, which is perfect timing. Long enough that you can practice the skills, but not so long that you've forgotten everything that I've showed you.
So I did do the background thing. I did my background thing today at the UPS.
Okay.
I was letting my mom help me because she is a nurse, and I was registering. I saved it, and I was about to pay for it and submit it. She's like, "Well, you can't register until after you do your background check." And is that correct?
Yeah, you definitely want to have a background check on file before you register. And that's because when you register, they go into the clearinghouse and look for your background check. If they don't have it, it's going to slow the whole process down, because now they've got to send a notice to you telling you to go get your background check, and then you have to go, and then they've got to go back and check for it. It just slows everything down. So actually, the background check goes to the clearinghouse almost instantaneously. So honestly, I would give it a couple of hours. So like if you're doing your background check at 2:00 today, I would register either tonight or tomorrow morning. Great question. Any others?
I've had background checks done in the past year,
Okay.
so do those,
Is it a level 2 background check with a photo in Florida for medical?
I'm not sure.
If you're not sure, go get one. Yeah. If you, level 2 background checks are done in a lot of different industries, childcare, if you're going to be security guard, banking requires a background check. I mean, background checks are, almost every industry requires a background check. Foster care system, going to schools, background checks are pretty common. A level 2 background check means it's not just Florida. They're going to look elsewhere as well. And photo enabled means that we're going to take a picture of you as well. Well, not all background checks have pictures. Now, a level 2 photo enabled background check with a picture is one thing. Medical is a filing cabinet we're going to find it in. Does that make sense? So the background check is here, but the medical part is the filing cabinet they're going to look in. They only look in the medical filing cabinet. They don't look at the daycare filing cabinet or the school system filing cabinet or any of the others. So that's why I say for medical, because if you're not in the clearinghouse, you may have had a background check done last week, but they can't find it. Now, this is actually a law about 8 years ago or so. I don't remember the exact time frame. Could be longer. Florida voters actually voted on this. They wanted to have one filing cabinet for all background checks, no matter what industry, so that if you went to work at a daycare, they could pull your background check if you had one done for medical. Florida voters said no. They did not want that information shared across agencies. So that's why we have to have background checks specific for medical. Does that make sense? Okay. Unfortunately, I did not write that rule. Okay. Live game show will be 2 weeks. So the last, your next game show will be the week after graduation. So the 1st and 3rd, I think it's a week after. Maybe it's your last week. The 1st and 3rd Tuesday of each month. And that game show will help you understand the types of questions that you would see on the written exam. So I believe this is our last review. I'm pretty sure this is the last one. How do we know what to do with each patient? Care plan. This should be like, you should be eating and sleeping and breathing this. This should be a no-brainer for you because you've heard me say it so many times. Now, I'm working on the new videos, and I spent the last, bless you, the last 4 days editing, and I've got 2 videos up already. Pulse and respirations, the new videos are already up on my YouTube channel. I was working on partial bed bath. One of the things that we did with these particular videos is I have put the checkpoints on the bottom of the screen. So every action that you see, the checkpoint that requires that action is on the bottom of the screen. So it's very, very helpful for students to be able to match the action with the checkpoint. But one of the other things that we did with these videos is we taped common testing errors. Now, I haven't done anything with these yet. I've got to get the actual videos done first. But coming up, you're going to have common testing errors. And one of the most common testing errors for every single skill is not following the care plan in some way. So if you're going to do range of motion, right, it's one of the skills that you're going to do. Let's say you're going to do range of motion shoulder, and you decide to do extra exercises to show them that you know how to do those extra exercises. Is that going to help you? Why? Didn't follow the care plan. That is the most common reason for failing the test, is not following the care plan. That's why I drill this into you. The most common test failure for every skill is not following that care plan in one specific way. It's like everybody picks one way and then they don't follow the care plan. It's crazy. But it's important that you understand this, because it's not about the test. It's about what happens after the test when you go to work. If you're going into a facility and you're the one deciding, okay, I think I'll do this today, or I think I'll do that today, or this patient probably needs some range of motion, I'll just go ahead and do that. That is not in your scope of practice. And you're going to be liable for the actions that you take. And that's why I really need you to understand this topic. Does that make sense? Good. So we follow the care plan, the whole care plan, and nothing but the care plan. We don't add to it. We don't take away from it. We don't change it in any way. If you understand this, half of the test, half of the written test, you'll be able to answer. Half of the written test is going to try one of the answers for all of those questions, half of the test. One of those answers is specifically written to get you to not follow the care plan. Isn't that crazy? The way they write these questions is very, very scientific. Each answer has to follow a format. So you'll have a question and the right answer. That's pretty simple, right? Question, right answer. But one of the wrong answers is all about not following the care plan. Another wrong answer is going to violate a patient's right in some way. And another wrong answer is going to have to do with safety. Isn't that crazy? So every question, when you answer those questions, tells them something about you, not just that you can pick the right answer, but if you're picking the wrong answer, it's telling them something about you. Isn't that crazy? So we want to make sure that we understand this, because a lot of the questions are going to specifically try to get you to not follow the care plan. Now, I do want to say really quick, time out here. There's one situation where you can't follow the care plan as a CNA, and that's during an emergency. Because during an emergency, the care plan isn't going to help you. The care plan is about routine tasks on stable patients. So emergencies, care plan doesn't help. You have to know how to act in an emergency without the care plan. So that's what chapter 3 went over. How to respond to a fire, how to respond to a fall, how to respond to a chest pain, how to do CPR. And CPR is not required for the test. It's not required for the class. It will be required wherever you go to work, but that doesn't mean you're not going to be tested on it. So you do have to know how to do CPR to be able to answer the questions on the test. Does that make sense? That's why we spend so much time on the care plan, because it's going to help you with the written test. It's going to help you with the skills test, and it's going to help you out there when you're working with real patients. So while we're following that care plan, we're going to observe for any abnormalities, and then we're going to report those to the nurse. Anything that looks, smells, feels, or sounds kind of funky, not quite right, we report it off. Every skill starts with an opening. Every opening starts with a knock. This is a graded checkpoint. And this is why I'm working so hard on these videos and putting the checkpoints right on the videos. So when I start the video, right on the bottom of the screen, it says knock or announce self before entering room, so that you can see it's not just a nice thing to do. It is required by the test. Once we enter the room, we're going to greet our resident by name. We're going to not call them honey, sweetie, those pet names, by name. We're going to introduce ourselves by name and title. We're going to describe what we're going to do and get permission. Once we have permission, we'll close that curtain, wash our hands, and then go get our supplies. But our cardinal rule here is don't touch patient until hands are clean. We have to evaluate if we need gloves for every skill. You cannot wear gloves for every skill. And the test, if you try to, will actually stop you. So if you're going to do pulse, right, that's one of the skills that you're going to do, and you're assigned to do pulse and you're doing it on her and she has no issues. She has no broken skin. She has no reason for you to wear gloves. If you grab a set of gloves before doing pulse, the test is actually going to tell you, you don't need gloves for that. There's two reasons for that. Number one, it's showing that you do not understand infection control principles. It's going to put your patient at risk. If you don't understand infection control, your patient is automatically at risk. The second reason is it's not a good use of supplies. Those supplies cost money in a clinical setting. Gloves cost money. Each one of those gloves boxes is somewhere between $10 and $12. On a good day, you'll go through an entire box. You're one staff member. One. Think about all the staff members. Think about all the gloves. The estimates are here in America, just in medical. I'm not talking about food service, housekeeping, industrial, just medical. We go through enough gloves to fill a football stadium 35 feet deep every day. Now, most gloves are not biodegradable. Those vinyl and nitrile gloves, we don't use latex as much anymore because people have latex allergies. Vinyl and nitrile gloves, they're non-biodegradable. That means that every pair of gloves you put on, every pair of gloves that you put on will be on this planet 100,000 years from now. And we're filling football stadiums with these gloves. So we have to be a little bit smart in knowing when to wear gloves. We can't just wear them routinely all the time and not expect some consequence to that. And the test is going to enforce that. So you can't just go in and put gloves on for everything. So we have to know when we should wear gloves. Well, if we're going to touch body fluids, personal skin, or non-intact skin, then you need gloves. Now, if I were the patient, if you were going to take a pulse on me today, you see that? My puppy got rambunctious on me this morning. I now have an open skin area. Would you need gloves? If you were going to be on this hand, if you're going to take my pulse on this hand, yes, you would need gloves because I have an open skin area that you could come into contact with. Make sense? You need to know that. If you decide to wear gloves, the first thing your gloves should touch is the patient. Not the supplies, not the curtain, not the table, not the privacy blanket, the patient. And then once you've worked with the patient, you've got to be careful about what you're touching in the environment with those dirty gloves. You also have to know how to remove your gloves correctly. And that's pinch up, pull off, go under, pull off. We need a clean place to put all of our clean supplies, so we're going to use a barrier. We're only going to touch supplies with clean hands, so we'll put the barrier on the table first. We'll go get our supplies and put them on the barrier after we've washed our hands. Remember, it's the first thing that we do. But when we're getting the supplies, we don't want them to touch our uniform because your uniform is not considered clean once you start working. Privacy blanket. We're going to use this anytime the patient's uncovered or undressed. Now, I want to remind you, everything that we're learning, all of these principles are not on the care plan. The care plan is not going to tell you use a privacy blanket for dressing. They're not going to tell you use a barrier on the table. The care plan doesn't tell us these things. That's why we have to learn these principles to be able to follow the care plan. So we're going to use a privacy blanket anytime the patient's uncovered or undressed. And this is specifically to provide privacy and keep our patients warm because the environments are usually pretty cold. We're going to put the blanket on top and pull the sheet down underneath. We don't want to do this. All right, Ms. Jones, I'm going to put a privacy blanket on you and then put the blanket on. You don't want to expose the patient. That blanket goes over the sheet. Blanket goes on, and then we pull the sheet down underneath. At the end of the skill, we're going to reverse it. We'll pull the sheet up over the blanket and then take the blanket out. Good? Make sense? Don't snap or shake that blanket. That aerosolizes any pathogens that might be on the bed that you can breathe in. And the privacy blanket is removed at the end of the skill after you remove your gloves because you don't want to touch that sheet with soiled gloves. It's going to go right up next to their face. So remember, we put our supplies away, we take our gloves off, and then we can take the privacy blanket off. Linen rules. We know most of these. They're repeats of something that we've learned previously. So we can't let the linens touch our uniform. We have to have clean hands to get our linens. Don't snap or shake them. Clean rolls toward me, dirty rolls away, and nothing touches the floor. Nothing. So, for instance, when you're doing a washing skill like hand and nail care, you don't want to just throw the washcloth on the floor when you're done with it. That would be insane, right? We wouldn't do that. Who does that? People do that on the test because they consider this a clean area, so they just throw the washcloths on the floor. Don't do that. Nothing goes on the floor. Not clean, not dirty, nothing. If you take something from clean supply, you can't return it. You have to use it or discard it. Use it or lose it. Yeah, absolutely. On the barrier. So we're going to have like a little area that we put all of our dirty stuff. You don't want to put the dirty stuff on top of the clean. Right. But yes, we're going to carve out a little space to put our dirty items on. Keep them separate from the clean, but don't put them on the floor. Good. I know, crazy, right? Scoot and roll. Patients always have to be in the middle of the bed. We can't rely on side rails to keep them there. Yeah, we are on scoot and roll. We can't rely on side rails to keep them there because side rails require a doctor's order. They're a restraint. We don't need them, though. As long as patient stays in the middle of the bed, they're safe. Now, if they're on their back in the middle of the bed, they're good. That's normal. If we have to turn them on their side, you're not simply going to roll them on their side. You're going to scoot them towards you first and then roll them so that after the roll, they're in the middle of the bed. So patients must always be in the middle of the bed. Do not roll a patient toward you. Weight distribution. Gravity will pull them back onto their back, and that's too far away for you to stop. You'll end up straining your back or hurting them. In fact, the most common thing that happens when somebody turns a patient toward them and gravity starts to roll them away, when you try to stop that, you're going to end up falling on that patient. And reflexes mean that it's an action that occurs without you thinking about it. That's what a reflex is. Your reflex is going to be to catch your weight. You see what happened? That causes injury to the patient. Do not roll a patient toward you because you can't change your reflexes. Your reflexes will always put your hand down to stop your fall, and the patient's right under you. The other thing is, don't turn a patient towards your crotch. That's just wrong. Don't do that. So we remain behind, the patient's behind. Washing rules. All washing is done the same way. We have a couple of different washing skills that we've learned. We learned hand and nail care. We've learned foot care. Today, we're going to learn partial bed bath. On Wednesday, we're going to learn peri-care. And next Monday, we'll learn catheter care. So we have 5 different washing skills that we do. So this really counts. Now, this has a lot of principles to learn. Washing rules is probably the hardest thing you have to learn as a CNA. Basins are no soap zones. We don't add soap to the water because we need water to rinse. We use a paper towel to turn the faucet on because your hands are clean, the faucet is not. We're going to check the water with the inside of our wrist. It should feel warm, not hot, not cold, just warm. But just because I think it's comfortable doesn't mean my patient's going to agree, so we have to have them check it as well. Good. We're going to use the leaves method for wet body openings, and we're going to talk about that today. I'm going to teach you that. You don't know that yet. Whatever we wash, we rinse. Whatever we rinse, we dry. We change the water if it gets cold or soapy, so pay attention to your water. But in reality, get through the skill pretty quickly, and your water doesn't have a chance to get cold. Don't take forever at this. Don't get the surface wet, whether it's the table, we've got a barrier, whether it's the bed, put a towel or a barrier under what we're washing, or the floor. Make sure that the floor is protected. We don't want wet somewhere. And anytime we put lotion on, we're going to warm it up in our hands and then wipe off the excess. All basins are cleaned the same way, and these two go together. Washing rules and basin cleaning tend to go together because washing rules, you have to have a basin of water. So these two always go together. So anytime we have a basin that needs to be cleaned, we're going to clean it the same way. We dump it wherever it would normally go. Don't get overly involved in this. Don't put urine in the sink. Kind of that simple. We're going to dump it, rinse it, set it down, and disinfect it per facility policy. Well, for the test, there is no disinfection. They used to have us spraying the basins with a disinfectant spray. I actually prefer that because during the test, those basins are used on you and you and you and you and you and you. And I think they should be disinfected. But because there's people that are testing that have respiratory issues, that aerosol can aggravate a respiratory issue. So they quit disinfecting. But we have to know how to disinfect if they should decide to bring it back, or if our patients out there need it. So we dump it, we rinse it, we dump that, we set it down. If we need to disinfect, that's when we would do it. You can't touch it and disinfect it at the same time. Hands off. Disinfect. Now it's clean. Paper towel to pick it up. Paper towel to dry the inside. Throw that away. Different paper towel to dry the outside. Remember, we disinfected the inside, not the outside. So different paper towel. Dry the outside. And then one to open the drawer because your hands are not clean. You don't want to touch that drawer with unclean hands. So use paper towel to open the drawer and put the items away. That's basin cleaning. And then we end the skill the same way. Oh, shoe rules isn't up there. Okay, we end the skill the same way. The first couple of steps, doesn't matter what order you do them, comfort, curtain, call light, clean and safe. So make sure the bed's in a low position, make sure the environment is clean. Is there anything else you need? Are you comfortable? Here's your call light, open the curtain. Do all of those things. I don't care how you do them, but get them all done. After you've gotten all of those done, then you'll clean your hands. If you need to document, you can now pick up your pen because your hands are clean and document. But our cardinal rule here is to end skill with clean hands. End skill with clean hands. So we have to wash our hands at the very end of the skill. But the whole goal here is to end skill with your patient feeling not just cared for, but cared about. So don't rush through this. One of the very, very common testing errors, is that candidates, people that are testing, will do the skill. And then once they're done with the skill, right? So let's say I've made her bed. Okay, so she's in clean sheets. And I've got a barrier here with dirty sheets on the barrier. She's in bed. My skill's done. No, it's not. You've got stuff on the table. You didn't wash your hands. This closing checks off a whole lot of boxes on the state exam. So don't just think it's about the skill. It's not. It's about this too. Good. The opening and the closing is going to check off roughly between 1/4 and 1/2 of all checkpoints for every skill. 1/4 to 1/2 of all checkpoints are checked off by the opening and the closing. That's how important it is. So I'm going to run through the skills really quickly with you. Remember, a pulse is a measurement of how many times the heart beat over 1 minute. Doesn't mean we have to count for a minute. We can count for 15 seconds and multiply that by 4 to get our minute reading, unless the care plan says otherwise. And this care plan actually tells us to count for a full minute, so we'll count for that full minute. Normal is between 60 and 100. Your radial pulse is located at the top of the thumb side of the wrist, way, way, way up here at the lines, not down here. We use 2 fingers, not your thumb. You want to use your fingertips, not the flat areas. For the test, you're going to say start and stop when you start and stop counting. And you can be off by 4 beats in either direction and still be accurate. This is a documentation skill. Dressing a resident. The way we remember this is USA first. Undress strong arm first. Dress weak arm first. You want to make sure that you limit the amount of time your patient is undressed. So we want to ask them what they want to wear, get the clothing before we undress the patient. We'll use a privacy blanket to keep them warm and covered until they're dressed. We're going to lift from below, support the joints. We'll undress the strong arm first, dress the weak arm first, being careful not to overextend or force movement. Remember, don't break their leg while you're trying to get them dressed. Adjust the clothing for neatness and appearance. Put the items in the hamper, and the call light goes in the stronger hand. Hand and nail care. This is a washing skill. We'll support that wrist and arm at all times. So when you're moving the hand, so if I'm doing hand and nail care, just imagine she's sitting up, right? If I'm moving hand and nail care, I'm not going to grab her here and kind of move her hand around. This is rude. What I want to do is lift and be gentle, making sure that it's supported at all times. On a towel, if it's on the table. We're going to soak the hand in water. Whatever we wash, we rinse. Whatever we rinse, we dry. We'll use the beveled edge, the flatter edge, to clean under the nails, wiping it off on the towel in between nails. We'll use the emery board in one direction toward the center. We're going to apply lotion last. And for this one, make sure the environment is clean at the end. So you're going to throw away the orange stick and the emery board. Clean your basin, get your soap and lotion, put it away. Making an occupied bed, it's a whole lot easier to make a bed with nobody in it. Way easier. So if a bed is empty, take a look. See, do I need to make change those sheets? But if the patient is in bed and we do have to change the sheets, it's a pretty easy process. You're going to change that bottom sheet a half at a time. So get the patient on their side so they take up less room. Clean rolls toward me, dirty rolls away. So the dirty one will roll toward the patient, tuck it under. Attach the clean sheet, roll it toward you, and tuck it under the dirty. And then you'll get them back on their back in the middle of the bed, go around the bed, and just do the same thing. Get them on their side, take the dirty sheet away, smooth the clean one out. You want to minimize wrinkles here. Remember, wrinkles contribute to bed sores. We'll put the sheet on top, the top sheet on top of the patient, tucking it in and making those hospital corners. We'll change the pillowcase last. That limits the amount of time the patient isn't on a pillow. And the opening of the pillowcase should face away from the door. Loosen the sheet over the toes as well so it doesn't pull their toes down. Side lying position. This is all about positioning. You can turn somebody bigger than you, no problem. Scoot them towards you first before the turn. Furthest arm up, closest arm over, closest knee bent, furthest knee angle, hand on shoulder and hip, and you roll them away from you. We'll put a pillow behind their back in a roll. Put one between their legs, specifically between the knees and the ankles. And you don't want the legs right on top of one another. Kind of offset them a little bit just because of weight. Get a pillow under that top arm to get it into a neutral position. Adjust the pillow under the head so it's just under the head and neck and not under that shoulder. And the call light goes in the bottom hand. Good. Foot care. You guys starting to see how much you've learned? It's crazy. Foot care, just like hand and nail care, a little lower. We're going to soak the foot, wash the foot, rinse the foot, dry the foot, but that's not why we're there. We are there to look at the foot. So you have to say something during the test like, I'm looking at your foot. Or I don't see any red areas, or your skin looks fine. I don't care what you say, but we've got to verbally acknowledge that we know why we're there. It's not about cleaning. We will apply lotion last, warming it up in our hands, but no lotion between the toes. We'll wipe off that excess lotion, put the patient's sock back on, making sure the toe seam is lined up, there's no wrinkles, and then put their foot in their shoe and fasten it appropriately. Mouth care. This is just brushing teeth. You guys all know how to do this. Patient must be sitting fully upright. We're going to protect their clothes. We'll wet the toothbrush first, put a little bit of toothpaste on there. We're going to brush everything they've got, top, bottom, front, back, and tongue. Let them rinse as much as they need to. Leave their mouth clean and dry. That is the number one testing error for the skill. Number one testing error is that people don't dry the mouth. They just walk away to clean the basin and leave that patient drippy, wet mess. Because you're focusing on the steps, not the patient. Take a minute, look at your patient. Always be looking at the patient, not your steps. But that's the number one mistake made on this one. Make sure they're to leave your patient clean and dry. And then we'll just clean the basin, store it the same way we do everything else. And at the end of the skill, you can ask them if they want the head of the bed back down, but it really doesn't matter. Whatever they want at the end of the skill. Well, we're working with body fluids. Remember, our glove rules are if we have any potential exposure to blood or body fluids. This is definitely a body fluid. So because there's an exposure, gloves are indicated. Absolutely. Respirations. Don't tell the patient you're counting their breathing. Did anybody watch? Has anybody seen this video, the new one? Okay, you got to go watch this because the new video, I put it up, I think on Friday or Saturday. I actually, you do the counting with me. I've got the camera like super zoomed in and you count the breathing with me. And I document what the breathing actually was. So it's just like you were doing the skill. So go watch the new video on this one. I'm really happy with the way this came out. Remember, in and out counts as one. Normal is between 12 and 20. We don't want our patient to know we're counting their breathing. So we're going to make this look like pulse. And we're not going to tell them we're counting their breathing. We're going to tell them I'm taking your vital signs. Say start and stop, just like pulse. This is a documentation skill. But luckily, the evaluators don't have to be like right on top of you, especially if you use an alcohol pad on their tummy to be able to see. That evaluator can be way over there. They don't have to be really close. So alcohol pads are good to use for the test. Range of motion. All range of motions are done the same way. Does it matter where you brush first? Great question, Bridget. No, they don't care. Top, bottom, front, back, tongue. Don't care. However you want to do it. You want to do the back first? Go for it. You want to do the bottom first? Okay. Does not matter. So all range of motions are done the same way. Doesn't matter what body part we're moving around. We're going to lift the extremity with a flat palm. Remember, nothing like this. We'll move slowly and smoothly all the way to start. 2 points of support. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around, and we just follow the care plan. Tells us what body part, what exercises, and how many repetitions. Whew. So on that note, let's learn another range of motion. This is going to be on page 80 of your book. Look how much you guys have learned.
Thank you.
Great question. We got a lot to learn today, and I do want to give you some practice time at the end of class today. You should have about roughly 45 minutes of practice today. All right, so if you look down the side here, there's nothing new to learn. All of the principles are spelled out here, and we've just gone over them all, so I know you know them. I have a video for this, and here is test-specific information at the bottom of the screen. Somebody with your level of experience should be able to do this skill in 4 minutes or less. 4 minutes or less. This is going to be done on another testing student, live patient skill. They'll be positioned in bed. Charting is not required. So just the skill-specific steps is what we have to go over. If we look at the care plan at the top of the page there, it tells us to provide the following range of motion exercise to the resident's right hip, knee, and ankles. Should I do the left one too while I'm there? No. All it says is flexion extension. That's it. Flexion extension. Should I do other exercises to show them how smart I am? No. Provide 3 repetitions of each exercise, and the resident is not able to help with the exercises. So pretty easy. Now, what makes range of motion hip, knee, and ankle a little different than the others that we've learned is the hip. The hip is a 2-for-1 exercise. So when we bend the hip, remember our patient is laying down, we want to bend both the hip and the knee at the same time. So this is going to look like they're climbing stairs. So the hip and the knee is bent at the same time. So 2 joints, 1 exercise. Now, the reason that you don't want to do the hip by itself, it's actually a really important reason, is because of our nerves. So along the back of the legs, you have nerves. And those nerves are already pretty tight. Not a lot of slack there. When we elevate the leg and keep that knee straight, it pulls on that nerve. It makes it super tight. And this can cause a condition called sciatica. And sciatica causes like a burning, sharp pain that starts in the butt and goes down the back of the legs and can last for hours, days, weeks after this is done because we've irritated that nerve. So when we lift a leg, you don't want to do a straight leg raise. You want to make sure you're bending that knee to cause slack in that nerve. Good? So that's it for hip and knee. You just bend the knee to the chest and back to the bed 3 times. That's it. That's it. Now, it also told us to do the ankle. So we're going to go down here to the bottom of the bed, and we're going to move it's flexion extension up, down. So we're going to move the ankle up and down. This looks like the patient stepping on a gas pedal. But we don't want that heel to scrape against the sheet while we do this. So we're going to lift the leg off of the bed so that heel isn't resting on the sheet just a little bit. Just lift it a little bit, and then we'll bend the foot forward and back 3 times. That's it. Put an opening in front of it, put a closing behind it, and that's the whole skill. Man, these are starting to look really easy, aren't they? Starting to look really easy. All right. So we're going to follow that care plan. Provide the following range of motion exercise. The resident's right hip, knee, and ankle, flexion, extension. Provide 3 repetitions. Resident is not able to help with the exercise. Remember that with range of motion, it will tell you which body part, which exercises, and how many repetitions. So we'll start with our opening. We'll evaluate if we need gloves. We might. If the patient has an incision, we might need gloves. If the patient is incontinent, we might need gloves because we're working near that area. There's a potential exposure for body fluids. But if our patient is another testing student that is fully clothed and holding on to all of their own body fluids like a champ for the test, you're not going to need gloves. Good. We'll support from below with a flat palm as we move. We're going to move slowly, smoothly, and all the way to start. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around. And we're going to ask about pain or discomfort. We have to do the closing at the end. So let me show you this video because it's got good close-ups of how to do each one of these exercises.
We didn't load.
Oh, okay. Range of motion at first.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Doing great. How about you?
Wonderful. I need to do some exercises on your right hip, knee, and ankle. Is that okay?
Yes.
I'm going to close your curtain. Let me go wash my hands, and I'll be right back.
Okay.
Okay, I'm going to do all the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay?
Okay.
The first exercise is going to bend your knee up to your chest and back down to the bed like you're climbing stairs.
Okay.
We'll do this 3 times.
Okay.
Please let me know if there's any pain.
All right.
I'm going to support under the knee and under the ankle, and we're going to lift and bend all the way up and all the way back down. Feel okay?
Yes.
We're going to do this again, all the way up and all the way back down. Still okay?
Yes.
One more. All the way up and all the way back down. Next exercise we're going to do will be on your ankle. I'm going to lift your foot off the bed and we're going to bend forward and backward like you're stepping on a gas pedal.
Okay.
We'll do this 3 times.
Okay.
So I'm going to lift and we'll bend forward and backward 1, forward and backward 2. Feel okay?
Yes.
And one more. Okay, any pain or discomfort?
No.
Is there anything else I can get for you while I'm here?
No.
Magazine perhaps?
No, thank you.
Okay, let me get your call light for you, and I'm going to open the curtain.
All right, thank you.
Here's your call light. If you should need anything at all, please let me know.
Thank you.
I'm going to go wash my hands. After washing my hands, I'll review the steps of my skill, make any corrections, and tell the evaluator my skill is done. Pretty easy, right?
You make it look easy.
This one really is, though. It is repetition. Absolutely. It's absolutely repetition. So I want to talk about that really quickly. When you're watching these videos or watching me demonstrate these skills, it's really easy to start to feel a little insecure. Because I do make it look easy. Guys, I've got over 35 years experience at this. I can't make it look hard. I just can't. I do this stuff in my sleep, literally. I'm on autopilot. Okay. You're not there yet. You are brand new. And remember that the test is entry level. So they aren't judging you compared to me. They're not. They are judging you compared to the checklist. Does that make sense? It does not matter how pretty it looks. It doesn't matter if you and your way through this. It doesn't matter if you stop in the middle and think or have to make 4 corrections. It doesn't matter. It doesn't have to look as pretty as I make it look. So I want you to take that stress off of yourself. It does not have to. In fact, if you go in and you make it look that easy, they might get a little suspicious. Wait a minute. Why are you so good at this? Because remember, this is entry level. Entry level means you haven't done this stuff before. So if you go in there looking as, if I went in there to take the test and I did this, they would be like, oh, wait a minute. Hold up. What's your story? If you're like, oh, I don't know, I'm just brand new at this, they're really going to look into you, because many years ago, there was a woman that was paid to take the exam for other people. So if you're really good at this, that is not the norm. They're going to pay attention. Make sense? So don't think it has to look like I make it look. You do have to get the checkpoints, though.
When you're doing this, we need to know per procedure in the book what we need when we walk in so that we can get it for each procedure, right?
Right.
And that's going to be part of the testing.
You have to know your supplies. Now, you're not graded on supplies. There's no checkpoint that says got the right supplies. No checkpoint at all. Remember, the checkpoints are there on the back of the yellow thing. You can look at the checkpoints anytime you want to. There is no checkpoint that says anything about supplies. None. You're graded on what you're doing. If you don't get the right supplies, that's going to affect what you do. So in an indirect way, you need to know your supplies, because if you don't get enough washcloths, you can't wash and rinse. So you're going to skip rinsing. Or if you don't get enough washcloths and you have to go back and get washcloths, now they're looking at infection control. Can you reach into that clean supply shelf unless your hands are clean? So you would have to take gloves off if you're wearing them and go wash your hands and then go get the supplies. So along the way, I've actually given you the answers to all of these issues, and you're going to apply them, because if you're in the middle of a skill and you realize you need a towel, my brain or my voice should trigger your brain. Wait, I can't reach in there with gloves on, and you'll go wash your hands.
Sorry, I forgot an extra washcloth, but let me be right back.
Absolutely. And who should you be talking to, the evaluator or the patient? The patient. Oops, sorry, I got Monday brain. Let me go get another washcloth. I'll be right back. No problem. You don't think you're going to have Monday brain on the job? You're going to have Monday brain on the job. Absolutely. 100%. What are you going to do then? That's what they're looking at. It's not about being perfect. It's not about being perfect. But yes, you do need to learn your supplies. It makes the skill go way smoother, way easier on the state exam. So yeah, you do need to know your supplies. Flashcards help. Flashcards help. Okay, good. Questions? All right, moving on. Denture care. Ugh, denture care. Go ahead and turn to page 96 in your book. Denture care is mouth care with an extra step. So everything we did for mouth care, we're going to do again. But we're going to clean the dentures as well. It doesn't matter which one you do first. If you want to do mouth care first, knock yourself out, no problem. If you want to clean the dentures first, no problem. However you want to do this is fine. I clean the dentures first because it actually saves time. And the reason is that when I go to the sink, I'm going to prep everything on my table. I'm going to get my denture brush wet. I'm going to get toothpaste on it. And I'm going to take that over to the sink. But I can't put that brush on the side of the sink while I'm getting everything else ready. That brush has to be in somewhere clean to keep it clean. I have an emesis basin. So that emesis basin is going to be my clean place for my denture brush. Make sense? So I'll prep my brush, get toothpaste on it, put it in the emesis basin, take it to the sink. It's got a clean place to live while I put my washcloth in, turn the water on, get my gloves on, all of that. If you do mouth care first, your emesis basin isn't clean. So you would have to clean the emesis basin before doing denture care and after doing denture care. So doing denture care first, you just have a clean brush in a clean basin. You don't have to clean the emesis basin before you do mouth care. So it saves time. It saves a step. But for the test, you can do it in any way you want to. If you want to do mouth care first, it's fine. You're not graded on that. It's just going to take you a little longer. Good? Does that make sense? So I'm going to show you the quick way to do it because out there, time matters. I want you to think about this, right? You guys all get a 30-minute lunch break every shift, 30 minutes. If you've got 12 patients and you spend an extra 3 minutes with each one of those 12 patients, that's not much. 3 minutes is pretty quick, actually, over the course of an 8-hour shift. 3 minutes, 10 seconds here, 20 seconds there, 30 seconds there. It's really easy. It adds up. If you spend just an extra 3 minutes with each one of your patients, you have lost your break. Little bits of time in healthcare matter. They add up. And if you can't take a break, first of all, you're going to burn out. But if you can't take a break, you need to start looking at where those little bits of time are going, because that's the problem. It's not a big piece of time. They're little bits of time that are all adding up. So time management becomes very important. And that's why I'm showing you the most expedient ways to do each one of these skills, because time is going to matter when you're working. Okay. So if you look here on page 96, you can see all of the principles involved in this skill. They're all spelled out for you here, and there is nothing we need to learn. I have a video for it. The short version is here. And down here, you guys are about to freak out on me. Somebody with your level of experience should be able to do this in 13 minutes or less. Easy. But look who we're doing it on. A live patient. That means you guys. Now, I don't expect all of you guys to go out and get dentures before the test. So how are you going to be a patient for denture care for the exam? So to understand that, we have to talk a little bit about dentures. So page 97 is going to give you the care plan for this particular skill. And at the top of the page, you're going to see a resident with dentures is sitting at an overbed table with their dentures in a denture cup. So to start this skill, your live patient is sitting at a table. The dentures are already out of their mouth and they're in a denture cup. That's how the skill starts. So you don't need dentures in your mouth for the test. They're already in the cup. Let's keep going. It says the resident's denture should be brushed with toothpaste and the resident needs mouth care. The denture is stored in a denture cup after cleaning. So are they asking you to put dentures in? No. And that's why anybody can be a patient for this skill, because it's all about that care plan. Make sense? All right. The resident is not able to provide own mouth or denture care. So we got to do it all. We got to do the denture cleaning. We got to do the mouth cleaning. Just like mouth care, though, if your patient can clean their own mouth, they will. If the patient can clean their own dentures, they will. So we're only going to do this when the care plan tells us to. Now, there's a couple of different types of dentures, and I need to make you aware of this. So when we think of dentures, we generally think of something like this. Okay, replaces all teeth. This is what we think of when we think of dentures. This is a top plate, and I know it's a top plate because it has a palate. This is what fits against the roof of your mouth. So this is a top plate. A bottom plate actually looks like this. It's kind of a horseshoe. It's got a cutout for your tongue. Okay, but this is a top plate. For the test, you're only going to have to clean one, either top or bottom, just one. But this is a top plate. Now, this is what we tend to think of, but all the teeth have been removed and replaced with artificial teeth. If the patient has healthy teeth remaining, we don't pull healthy teeth. We only pull the teeth that need to be pulled. And when we do that, we're simply going to replace the teeth that are missing. And we'll have cutouts for the teeth that remain. This is called a partial. So this is a full plate, and this is a partial. They're both cleaned exactly the same, but understand there is a difference. So if we have this, the patient has no teeth, they have gums. If we have this, does your patient still have some teeth? So that's going to kind of affect how we do mouth care. Make sense? Okay. Dentures are always stored in water so they don't dry out and become brittle. If the dentures dry out, they're likely to crack. So they're always stored in a denture cup in water. Then we have another little piece of a denture. This would only maybe fill in one or two teeth. This is just a small piece. Usually hooks on teeth on either side of it. This is called a bridge. Now, modern day, now most bridges are implants. So they're permanently attached. So you in your older patients, you may still see bridges. But these, as our society ages, will probably go away because bridges are becoming more implanted, one or two teeth. We can have implants for full teeth replacement as well. So they now have where the teeth go in and they stay in. They don't come out and get clean, just like your natural teeth. So this skill is going to require 2 steps. We're going to clean the dentures. We're going to clean the mouth. Do you think your patient wants those gloves that you just handled those dentures with in their mouth? No. So that means that we need 2 sets of gloves for this skill. One to clean the dentures and one to clean the teeth or the gums or whatever they happen to have. So there's 2 different ways to clean dentures. 2 different ways. How will we know which one to use? Easy answer. Care plan, absolutely. So one of the ways that we can clean dentures is with good old-fashioned toothbrush and toothpaste. Good old-fashioned. The other way to clean dentures is to put them in a cup of cool water with those little fizzy tablets. The method we use will depend on our care plan. Most people want this method, and that's because toothpaste is abrasive. Toothpaste actually has little microcrystals that are designed to scrub, and dentures are not natural living tissue. So when you have this abrasive toothpaste and we scrub the dentures, we can actually cause microcracks to form that bacteria can hide in. So a lot of people that make dentures will tell you, don't do this. Do this. This, the little fizzy tablets, because they fizz, they get in all the little cracks. And the chemicals in it are designed to break down food particles, saliva enzymes, and denture paste. So it's specifically made to clean dentures. The method we use will depend on the care plan. Now, this care plan for the test is going to tell us to use this method to brush the teeth or the dentures with toothpaste. So we're going to follow the care plan. But remember, in a clinical setting, there are 2 ways of doing this. When we clean the dentures, do I have a denture brush?
We have one of the kids.
Hold on, let me look. I think I might have one over here.
We have the smallest kit right here too.
Okay.
From this other kit.
Yeah, let me have the smalls kit. Oh, wait, never mind. Wait. Got it. Okay. This is a denture brush. Looks like what you see up there. It is double-sided. The reason for that is this looks like a toothbrush. We're going to use it like a toothbrush on the teeth part of the dentures. This part is more narrow, and it's designed to fit in that channel or that groove that goes over the gums. So this side is used for the teeth. This side is used for the channel. That's why denture brushes are double-sided. When we clean the teeth or the mouth that the teeth came out of, remember, if our patient has a partial, they still have teeth. If they have a full plate, that means that they just have gums. But when we clean the mouth, whatever they've got, we can use a toothbrush. Perfectly okay. It's okay to use a soft bristle toothbrush on gums. There's no problem with that, actually. The problem is that these dentures are held in by denture paste. It's a stringy, sticky, gooey paste that goes in this channel. And then when you pop the dentures in, it helps create suction and hold them in place. That denture paste, if you use a toothbrush, just pretend this is a toothbrush, that denture paste is going to get all bound up in these bristles, and it's going to become gummy, and it's not going to be very effective. So when we do mouth care on somebody with dentures, we usually don't use a toothbrush. You can, but we usually don't. We use something a little bit different. Okay, Jake, I do need smalls kit. We're going to use a special, thank you, a special type of toothbrush called a toothette. It's also called an oral swab. This is soft and spongy. I'm going to pass this around so you guys can see. It's soft and spongy. And we're going to use it just like a toothbrush. We're going to dip it in water. We're going to put toothpaste on it. We're going to use it just like a toothbrush. But because it is a solid surface, whoop, all of these things are in the drawer here for you guys to practice with. Practice kits have all of these as well. But when we use this, we dip it in water, put toothpaste on it, and then we use this to swipe away that denture paste. Thank you. We use it to swipe away that denture paste off of the gums or the teeth. And because it is semi-solid, spongy, but semi-solid, we can swipe and then rotate. Now we've got a clean surface to use. We can swipe and rotate. Now we got a clean surface to use. Clean surface, clean surface, clean surface, clean surface. 4 sides. See how that could be helpful? And these are disposable. You just throw them away. So usually when we're doing mouth care for dentures, we're going to use one of these, one or more. If the patient has a lot of denture paste, you may need more than one, and that's okay. But we usually use these because they are disposable and it won't get all bound up in that denture paste.
Practice kits. I saw that there's teeth in there. Is that the dentures?
Yes, they're actually denture simulators. They're not real dentures. Can I have a simulator?
Just asking because I was a little confused.
Yes, so this is what, I'll pass these around. This is what a denture simulator is. It kind of looks like dentures. Kind of looks like dentures. It even has a channel. And this is just simply for you guys to be able to practice because it's a simulator. Like you can't actually put this in your mouth. It's not going to work. It's a simulator. But it will still allow you to take your denture brush and clean. So these are the denture simulators that are in the practice kits. My mom actually makes these for me. Isn't that cool? We are a true family business. Yep. My mom's got a whole setup in the front room of her house where she manufactures denture simulators. It's pretty cool. All right. So everybody understand how denture brushes work? And we use toothettes to clean the mouth that the dentures came out of. That just keeps that denture paste from getting all bound up in those bristles. So when we're doing this skill, we're going to wet the denture brush. We're going to apply toothpaste to both sides, and we're going to let it rest in the emesis basin until we're ready for it. We'll go over to the sink. And all that basin is doing is holding that denture brush when we get to the sink, because you don't want to lay it on the side of the sink. That's just pretty gross. So that emesis basin is just holding that denture brush. When we're going to clean the dentures at the sink, you don't want those dentures to break. So we have to line the sink with something that's soft. A washcloth, a towel, paper towels might work, but you want to wad them up, and you'd have to have quite a few of them. Don't lay a paper towel flat because that's not going to provide any protection at all. So washcloths really are best. If you can get that washcloth over the drain, it's even better because that allows the water to pool up in the sink. And if the dentures do fall, guys, think about it. Dentures are, kind of slimy already. And now we're brushing it with toothpaste. That's going to make it super slippery. So those dentures are likely to fall out of your hand during this skill. So if you've got water built up in that sink, when the dentures fall, they hit the water, not the sink. And then they just kind of slowly sink to the bottom. So if you can get that washcloth over the drain, it's even better. But definitely a washcloth in the bottom. We'll use a paper towel to turn the water on because our hands are clean. And we're going to use cool water, not hot. There's a principle here. The CNAs, you don't have to know this, but there's a nursing principle: heat coagulates proteins. And all that means is that hot water is going to make protein molecules stickier and harder to remove. Well, you've got protein in your saliva. There's protein in the foods that you eat. There's protein in the denture paste. There's protein everywhere in the mouth and on the dentures. If you're using hot water, those proteins become harder to remove and it'll hold on to bacteria. So we want cold water here, which helps release those proteins. Good? Makes sense? All right. So we use cold water. When you have the faucet running and you're ready to clean the dentures, and you get those dentures out of the denture cup, Remember, that's where they'll be when you start. When you get those dentures out of that denture cup, they have to stay in your hand. The only two places these dentures can go, in the cup or in your hand. Don't clean them and then set them down in the sink or on the side of the sink. The denture cup or your hand. You can put it in the clean emesis basin if you need to, but I'd prefer that you just remember hand or cup. So we are going to wear gloves for this because saliva is a body fluid. And the first thing our gloves should touch is the patient, or in this case, what's coming out of the patient, the dentures. So the first thing our gloves should touch is the dentures. That means we had to do all of that stuff before we got to the sink. We had to wet our denture brush. We had to put our toothpaste on the denture brush. We had to bring everything over to the sink. We had to put the washcloth in the sink. And you can put your gloves on now or after you turn the water on, doesn't really matter, but you have to use a paper towel between your hands or gloves and the faucet. So then we're just going to brush. This is the easy part. You just brush. Brush whatever's there. Now, these are real dentures that you're going to use for the test. Real dentures, just like this. Real dentures. They've never been really used, but they're real dentures. When you brush this, because they've never really been used, and a million candidates before you have done denture care, they're nice and clean. There is nothing to brush off of here. There is no paste. There is no food. It's clean. So just brush. Just brush. Brush the top, brush the bottom. Make sure you got toothpaste over the whole thing, and then you can rinse. Remember that we want to keep everything over the sink and the dentures in our hands. We're going to rinse that denture cup out, and we're going to fill it up with cool, clean water. And then we'll put the dentures in the cup that has water in it. We'll put the lid back on. You can turn the faucet off now. But this cup, after it's been rinsed, and I filled it up with water, and I put the dentures in it, and I put the lid on it, it is wet. Do I want to put this wet cup on furniture? If you ask Grandma, she's going to tell you it's going to leave a ring. She wants a coaster under this cup. So we're going to use a paper towel to dry the cup and as a coaster. So when we bring this over to the bedside table, it should be on a paper towel. Good. Now I want to talk to you really quickly about dentures themselves. CNAs do not take dentures out, and CNAs do not put dentures in. Thank you. That is not our job. We don't do that. The patient has to be able to take their own dentures out and has to be able to put their own dentures in to be able to use them. If they can't, we don't give them their dentures and we puree their food. We chop it up really fine so they don't have to chew. Now, the reason for that is safety, the patient's and yours. And let me explain. When we are taking out dentures, if I have dentures in, if I was wearing dentures and I wanted to remove the dentures, my top plate, I have to put my fingers all the way into the very back where those dentures end. And I've got to pop them down. The bottom plate, when I put my fingers in, I have to pop them up. Everybody with me so far? Remember, they're being held in by sticky paste. So we've got to use quite a bit of pressure here. Now, the bottom one is the problem. Because if I put my fingers way back here on myself and I pop them up, I'm not putting much leverage on my bottom jaw. It's just the way my fingers are. I'll pop them up, no problem. But if I did that on you, if I put my hands in your mouth, in order for these fingertips to pop the denture up, these knuckles have to press down for leverage. And when you press down on the lower jaw, particularly near the back, near the joints, you can dislocate that jaw pretty quickly. CNAs do not take dentures out. Now, putting them in, there's a risk to you. Because when you put dentures in, your patient will reflexively, remember reflexes are something that we can't really control. They will reflexively bite down to seat those dentures to get them in the right place. If your fingers are in the way, you are going to be bit. And it's not the patient's fault. Remember, a reflex is something we can't control. So if your fingers are in there, you're going to get bit. And you're probably going to be really mad at your patient because they bit you. It's not their fault. Your fingers were where they shouldn't have been. We do not put dentures in. We do not take them out. The patient has to be able to do that themselves, or we don't give them their dentures. We simply puree their food. So once I've got that denture cup cleaned, it's on my bedside cabinet on a paper towel. Then I can get my washcloth, wring it out really well, put it in my hamper. I'm going to grab that emesis basin with the denture brush and bring it over to the table where my patient is sitting. And now we're ready for mouth care. Now, right now, though, I rinsed the denture brush out, while I was cleaning. Right now, though, I've got that rinsed denture brush, which is wet, inside that emesis basin. And my patient's going to need that emesis basin in just a second to spit in. So I've got to move that denture brush. We know that denture brush has saliva on it. We just brushed dentures. So I need to take that denture brush out and put it on my barrier before I take my gloves off. I don't want to touch that denture brush with bare hands. And I don't want to touch that denture brush right before with the second pair of gloves right before I brush the patient's teeth. I want clean gloves for the patient's mouth. So we're going to bring this basin over with the denture brush, put it on the table, take the denture brush out, and put it on the barrier. Then we can remove our gloves. Now, once I've removed my gloves, we're going to put the toothette in water to get it wet. We'll put some toothpaste on the toothette. We're going to put it in the basin for prep, and we're going to get our towel on our patient. Notice the gloves are still on the table while we're doing all of those things. Once we have the patient prepped, then we can put our gloves on, because the first thing those gloves should touch is the patient. And then we're going to brush. Whatever they got. I don't care how you do it. Top, bottom, front, back, tongue. Go to town. Once you're done brushing, we'll put that toothette aside and we can rinse.
When you take the first pair of gloves off, should you be washing your hands?
You don't have to, because it's the patient's cooties, their own cooties, and we're putting new gloves on over those cooties. So it's okay. Now, if I were moving from patient to patient, what I need? Yeah. But patient's cooties, their cooties are okay. So we're going to brush. We'll throw that toothette away when we're done with it. There's always a trash can right beside the bed. Throw the toothette away. Let the patient rinse and spit as much as they need to into the emesis basin. Leave the mouth clean and dry. We've done this with mouth care. This is not new. Leave the mouth clean and dry. And then we're going to do our cleanup and our closing just like we did for mouth care. Nothing new to learn there. The practice kit does have everything in it, including the denture simulator, which is not in this image. Okay. So the practice kit would help you. I have dentures here. denture simulators here. We have the toothettes, we have the denture brushes, we have everything you need to be able to practice this skill right here. So during practice time today, this would be a good skill to practice because you probably don't have these items at home. All right, so let me show you this video. And then we will take a break and talk about energy conservation.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with a paper towel to store the basin and other supplies. I'll remove the barrier from the table and we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
Coming up.
All right. Any questions on that? I will tell you, this is why I wait until the halfway point to show this skill. This seems to be the hardest skill for students to learn. I don't think it's that hard. I think if you think about it in two parts and you already know one of the parts, it really simplifies it a little bit. But there's a lot of steps to that skill. And because it is in two parts, it tends to be a little bit more intimidating. This is one that I definitely would recommend that you practice because it will help increase your confidence going into the test. It's not frequently failed. There's a huge margin of error on this one. They're not really grading you strongly on infection control or anything like that. It's don't break the dentures. Don't put them in the sink. That's what they're looking for here. It's not graded heavily, stringently, but it does seem to be the most intimidating to students. So just kind of keep that in mind. Okay. Let's go ahead and take our break. When you get back, we will get into ambulating with a gait belt. All right. Any questions so far? All right, let's talk about energy conservation. This is a topic that's not intuitive, that we really do have to kind of talk about it because it's not something that you'll most likely think about on your own. How many guys have ever seen a 2-year-old? 2-year-old. 2-year-old, little guy. Right? I love 2-year-olds. 2 and 3-year-olds, that's the most fun age. Yeah, I love them. 2-year-olds will jump up and down for no reason. No reason. None. They will just bounce because they have excess energy. When was the last time you bounced for no reason? Probably when you were about 2 or 3. Yeah. Have you ever tried to explain to a 2-year-old why you don't have the same energy that they do? Have you ever tried to explain that? They don't get it. They just don't get, because they have no frame of reference. All that they have ever experienced is their own energy level. They can't understand why other people don't have their energy level. Make sense? They have no frame of reference. That's relevant to what we're about to talk about today, because that level of energy does not last. It does not persist. And in fact, it starts to decline pretty quickly. 2 and 3-year-olds, that is the most energy you will ever have in your entire life. That is when you max out. If you go forward in time just about 10 years, let's go to 12 years old, okay? 2-year-olds, tons of energy. 12-year-olds, still tons of energy. I mean, 12-year-olds they still have tons of energy. But you put that 12-year-old in charge of that 2-year-old for one afternoon, who wins? 2-year-old. That tells you, right there, that tells you that your energy level has declined from 2 to 12. Now, we're way on the other side of this graph. So we look at that 12-year-old and think, oh my gosh, you've got so much energy. But they still don't have the same energy as a 2-year-old. Now, let's go out to 22. 22-year-olds will shop till they drop and go out at night looking fabulous. Still tons of energy. Tons of energy. But they don't have the same energy that they had when they were 12. Let's go out to 42. Now, 42-year-olds, they'll shop till they drop, but that's at like 2, and we're not going out tonight. We're done. So still tons of energy, but not as much as you had when you were 22. Let's go out to 62. Now, 62-year-olds, we're starting to slow down a little bit. We're thinking about retirement because there's just not enough energy for daily tasks that we have to do, plus all the work tasks that our job requires. We're probably putting our feet up for 10 minutes before we make dinner. We're slowing down. We don't have the same energy that we had when we were 42. Now let's go out to 82. What kind of energy levels do you think they're going to have? Okay, they only have this much energy because energy levels decline throughout the lifespan. Now, do you remember what we talked about trying to explain to a 2-year-old why you don't have the energy that they do? They don't get it. They don't have anything to compare it to. They have no frame of reference. Well, if you're down here as an older person and you don't have much energy, but you're trying to explain to these guys up here that you don't have as much energy, it's like you trying to explain to a 2-year-old. They don't get it. They don't get it. And this sets up some very negative patient encounters, because you, somewhere in the middle, will go to a patient and say, Miss Martha, it's time for your shower. And she's going to go, oh, honey, I don't have the energy for that. And you're like, I do all the work. All you got to do is sit there. What do you mean you don't have the energy for that? You are trying to tell her that she has more energy than she does. Just like a 2-year-old trying to tell you that you have the energy to play with them. Do you see how that can set up a negative patient encounter? When she says she doesn't have the energy for that, she means she doesn't have the energy for that. And let's try to figure out why. Let's think about all the things you do on a daily basis that take energy. What do you do on a daily basis that takes energy? Me? Getting out of bed takes like half of my energy every day. I like bed. So getting out of bed takes a ton of energy. What else do you do? Okay. So let's even simplify it a little bit more than that. Let's just talk about the ADLs that we do. Does it take energy to go to the bathroom? Does it take energy to eat? Have you ever been too tired to eat? If you've ever been too tired to blank, it means that takes energy. Have you ever been too tired to talk? On Mondays and Wednesdays after class, I am too tired to talk because I talk nonstop for 4 hours and I'm tired of talking. If you've ever been too tired to, it means that takes energy. So eating takes energy. Bathing takes energy. Dressing takes energy. So even the most basic tasks that we do every day takes energy. Now, if this is all the energy we have, that can be a problem. If we know that bathing and dressing and toileting and grooming and all of those things take energy. Do you see how that might be a problem? Now, have you ever seen an older person try to get up out of a chair? Have you ever seen that? It goes something like this, right? I call it the rock and roll method. They start to rock. And then once they get up some momentum, they roll out of the chair. And usually the first time they'll roll right back. And we got to do it again. So I rock, get my feet set, roll up. Ugh. How much energy did that take? A lot. It took a whole lot more energy than if I had simply stood up, right? Whole lot more energy. If I've only got this much energy and it takes that much energy to get out of the chair, that's going to be a problem later today because I got to do all of these things. And all of these things usually require me getting out of the chair. So I have to get out of bed first. Then I have to get to the toilet. We got to sit down on the toilet, go, and then get up off the toilet. And then I go back to the room and sit down in the chair. And then you come in and it's time to do some grooming. So I have to get out of the chair and go to the bathroom, do my grooming. Go back to the chair and sit down to rest a bit. Then we have to get dressed. I've got to stand up to dress. Sit back down and rest. Then I have to go to breakfast. I got to stand up to go to breakfast. Get there. Sit down at the table. Eat. Stand up from the table. Go back to the room. Now I got to go to the bathroom again. Stand up. Go back to... Do you see how many times we get in and out of a chair just to do these things? Now, I'm not talking about working. I'm not talking about keeping house. I'm just talking about the very basic things that we have to do each day. And if we've only got this much energy, we're going to run out. So one of the things that you need to understand is when strength decreases, energy has to increase. It's just simple physics. As we get weaker, and remember we learned with chapter 4 that muscles start to break down and atrophy as we age. When we get weaker, it's going to require more energy to do simple tasks. Well, we're already starting out at a deficit. And now, because we're weak, each one of those activities is going to require more energy. So it doesn't take long to realize that we can get about halfway through this day and run out. It does not matter how much you think I should have. That doesn't play a role in this, does it? So this is a problem for CNAs, and it's probably not something you ever thought about because remember, you're way on the other end of this energy graph. You wouldn't have considered this. When an older person says, I don't have energy for, especially in the afternoons, we have to believe them because they mean, I don't have energy for. And even things that you think don't require energy. Just sitting in a shower chair, getting bathed by somebody else, you are undressed, you are shivering, you are cold. That still requires energy. Good. Now, some of this is going to relate directly to your patient's circadian rhythms. Now, all of us have different preferences and normals. How many of you guys are early birds? You like to get up early? Anybody like to get up early? Okay, I've got a couple early birds. You're probably more productive first thing in the morning. Okay, early birds usually are. They get up early, they're productive, they like to watch the sunrise. I am not that. I am a night owl. And there are people that tend to come alive about 4 or 5 o'clock at night, and they're more productive around 10 p.m. to 2 a.m. That's just when they're the most productive. That's me. That is my circadian rhythm. I don't like mornings. I don't do well with mornings. I do better in the afternoons. And then there's people right in the middle. They're not really early birds, but they don't mind getting up earlier. And they do well in the middle of the day. But, somewhere around 8, 9 o'clock, they're pretty much done. Okay. So you have to think about if we have differences, do you think your patients might have differences? So if we have an early bird that gets up early, just their normal cycle, they function better early in the day, and they've done all of these things all day and used up all of their energy, and we come in at 7:30 at night and say, Miss Martha, it's time for your shower. Miss Martha's like, I don't think so. It's like an hour past my bedtime. This is not going to happen. Now, CNAs usually get mad at that patient because CNAs are all about my schedule. You're throwing my schedule off. Is the patient purposefully trying to make your life difficult? No. And yet we act like they are. Do you see how this could set up a negative patient encounter? So when we're relating to patients, we have to take all of these things into consideration. We have to think about what kind of patient we have. Is this person, and I'm talking about just this one, not the whole floor, just this one. She's an early bird, so she probably needs to be on the morning shower schedule.
Isn't different, this is more to nursing home, different nursing homes have like scheduled shower times, because I have seen that
Yes.
before, where they have scheduled, hey, this floor or half this floor, from here down, the shower time is this and then that.
Right. So if you notice that your patients are, you have one patient that never lets you shower them, right? They're on an early morning shower and they always say no, and it's been like 2 weeks and they haven't bathed, and this is a problem. Is that an observation? What should we do with observations? Tell the nurse. Absolutely.
Now I have a question. Let's just say if we do make coffee, tell the nurse, will that nurse just say, hey, he or she won't let me bathe them? Is there anything I can do? What will that nurse tell you? Oh, I'll give it to another CNA, or
Depends on the nurse. And I would love to tell you that all nurses are there for the well-being of the patient. I cannot. I can't. That's a flat out lie. I wish they were. So you may give that observation to the nurse, and the nurse is like, well, I can't do anything about that. They're on this hallway. They have to be showered in the morning. They're going to have to deal with it. That's probably the response you're going to get, but that shouldn't stop you from bringing it to their attention. Okay.
Where I used to work, we actually had something similar. What they ended up doing was they switched one person from this side of the hall and actually made them that we had to bathe early in the morning since they were more of a morning person. And then the other person that they just switched them to nights is what they ended up doing. It was the greatest thing because the lady would prefer the morning and then that person went, so they just switched it.
They just switched it, yeah. But the nurses aren't, because the nurses aren't the ones showering, they don't know. They have no idea. They're doing nursing type stuff. So we rely on you to let us know that. And if you've got a good nurse, that's exactly what they're going to do. They will accommodate patient care based on that specific patient. And like I said, I really wish I could tell you that all nurses were in it for the good of the patient. My mission in life is to reinforce patient-centered care, making the patient the center of the care. And this comes through in everything that I teach you. Now, my hope is, because I'm getting you from the very beginning, my hope is that all of you will take these principles that I teach you out into the workplace. And those of you who go into nursing, who go on, you will take these principles into nursing as well, because you're learning them from the very beginning. That's my hope. I'm hoping to influence an entire generation of nurses by starting here. It's not about us. It's always about the patient. And we tend to forget that, because when we go to work, it becomes a job. And we're just there to do the tasks that we need to do and get them done so we can get back to our real life. This is their real life. And we tend to forget that. So I spend a lot of time on this topic because I think it's important. No, I know. That's the danger. Yeah, that's the danger, because you have been taught to do this patient-centered. Yeah.
My grandfather went to a nursing home and they lost his dentures and they weren't taking, I'm like, oh no,
my gosh.
I know how this works.
Mm-hmm.
What are you doing with them? What is going on? How are you taking care of them? They didn't like that. They don't like that.
Yeah.
They don't like
Yeah.
somebody that comes in and picks around.
But if we had more people that held staff accountable, we could make a difference. We could make a difference. Absolutely.
And it makes your life difficult when you do make waves in the working environment.
Sure, it does. It absolutely does. Yeah. Like I said, I really wish that I could tell you, if I were a director of nurses at a nursing home, my nursing home would be run a little different than what you see out there. And I would not have a shortage of people to work for me, because I would insist that things are done right and we support each other as well as the patients. So we have to understand that a lot of these issues that you're seeing are going to start in management, not with your coworkers. I can't fix that. That's a battle I can't fight. All all I can do is train you the way I would want to be cared for and hope that you land in a place that will let you provide that patient-centered care. If not, you're going to have to compromise where you see fit. I can't answer all those questions for you, unfortunately. Yeah.
Good rule of thumb is treat somebody the way you want to be treated.
Absolutely. Absolutely. Guys, I'm getting older. I will be, not might, I will be the body in the bed in your lifetime. I will. Not might. I will. So my goal here is very personal. I am training you guys to take care of me. It's very personal. I'm telling you to apply this to other people, but this is very personal. And it's the same way you would want to be cared for.
Yeah, because eventually your parents are going to be the ones if they decide not to go into a clinic, or into a facility. I mean, I cared for my mom before she passed.
Not just your parents, you.
Yep.
You. I mean, unless an asteroid takes us out in 2034, whenever that one's supposed to hit, unless an asteroid takes us out, you guys will all get old. Or even worse, you guys will get sick young and have to have somebody take care of you. Very few people get out of this life easy. So this matters.
My kids take healthcare very serious. I teach them all day and night.
Awesome.
They come back and say back to you, I'm like, you were listening. You are watching.
Very good. I love it. I love it. All right. So if we've got all of these tasks that need to be done, and we know our patient's strength is decreased, that means they're going to need more energy to get each one of these done. There are some things that we can do to help out. And one of those things is to lend them some of our strength so it reduces the amount of energy that they have to expend. Now, let's play this out for just a second. If we have somebody that runs out of energy in the afternoon, that means that they're probably not going to eat well tonight because they're out of energy. So if they don't eat well tonight, what happens to tomorrow's energy levels? They go down. That's right. And now we eat less because we have less energy. This starts a downward spiral called failure to thrive. This is way more important than you think it is. Because patients that run out of energy and are still forced to do things tend to not last very long. So this does affect you. Absolutely. So if we can lend them some of our strength, because remember, we're way up here on the energy scale. If we can lend them some of our strength, it then results in less energy that they have to use. And that's what gait belts are all about. We are going to help our patients stand and sit when indicated in the care plan using a gait belt. And all a gait belt does is gives them some of our strength. We are using our strength to lift them so they don't have to expend as much energy. Now, some places, this is going to be on page 66, will teach you that you can pull on a patient's arms to help them stand. So you take the backs of their arms and you pull, but there's a weight distribution problem here. Most of our weight is centered below the level of our hips. So if we're pulling at the top of a patient up here, we're not moving them at the center of gravity. That means that we are going to have to press harder, grip harder, bless you, grip harder to pull pull them to a standing position. This can cause bruising, muscle tears, and because where our hands are on the backs of the arms, that's your brachial plexus. That's where all the nerves to your hands run. And compression of the brachial plexus can actually cause nerve damage in the hands. So don't grab somebody by the arms and lift them. Now, along the way, somebody says, hey, it'd be better if we lifted the center of gravity. And other people went, yeah, that's pretty cool. That makes sense. So we're going to lift from here. But if you don't have a gait belt, you grab the patient's pants and you lift them to a standing position. Have you ever had a wedgie? That's what you're doing, guys. You are giving them a monster wedgie and they will move. They will move quick. But they're not moving because they have the strength or the energy. They're moving because you are hurting them. Is that helping? No. That is why a gait belt needs to be used. A gait belt goes on over the clothing at the patient's waist. We grab the gait belt, and it's got to be snug, guys. If that gait belt is too loose, it'll go up under the breasts or under the arms, or the patient will slide right out. It's got to be snug. So we put the gait belt on around the waist, snug. We hold it on the sides or near the back, and we use that and our strength to help stand the patient up. That's what a gait belt is used for. Never use a gait belt to tie somebody to a chair or a wheelchair or the bed. I have seen gait belts used for all the wrong reasons. So a lot of facilities say, hey, no gait belts because we can't trust you to not tie your patient down. I saw one on Facebook Friday. Patient kept getting up out of the wheelchair and wandering. Somebody took a gait belt in the wheelchair with the patient in the wheelchair and gait belted, secured their legs to the legs of the wheelchair. Now, if this person tries to stand up and walk, they're going to fall flat on their face. Absolutely. That is not allowed. But you've got idiots like that. And yes, I will defend that. They are idiots. You've got idiots like that that give caregivers a bad name, and the facility has no choice but to say, no more gait belts. We got to do better, guys. We got to do better because a gait belt is an important tool to help our patients conserve energy. So if you have a coworker who's an idiot and does something like that, you need to report them. Don't try to save their job. I don't care how much you like them. That is not doing grandma any good. It's not doing our industry any good, and it's not doing our reputation any good either. Report them. Me personally, I'll probably take them out back. Don't do that. So that's what this skill is all about. Ambulate with a gait belt. This gait belt is there to help lift our patient to a standing position, provide a little stability while we're walking. And really, it's not even about stability. It's about us being able to gauge their stability. So when we're walking somebody with a gait belt, I've got my hand underneath that gait belt like this in an underhand grip. As they're walking, my hand is now in tune with what's going on in their body. If they slow down, I'll notice it. If they start to go back and forth, waver a little bit, I'll notice that. This hand is now accumulating info about my patient's well-being. But when you're walking, it's not just your hand that should be paying attention to the patient, it's your eyes as well, eyes on the patient. When you're walking somebody, they should be right in front of you to one side, like this, not like this. Your eyes are on that patient. And when you're walking, you should be watching them. If their hand goes out to their head or to their stomach, something is wrong. Something is wrong. If they get pale or sweaty, something is wrong. Now, the number one mistake that CNAs make is when they get over here and something is wrong with the patient, they try to hurry them back to the chair because the chair is safe, right? If they aren't tolerating a slow walk, what makes you think they're going to tolerate a fast run back to safety? And that's what ends up happening is that CNAs will go, I don't know, we were just walking and then they were on the floor. No, that tells me you were not looking. You didn't pay attention because your patients don't just walk along. I'm good, I'm fine. Ugh. It doesn't happen like that. Patients give you a sign that something is wrong. They slow down. They start to wobble. Hand goes out, up, stomach. They get pale. They get sweaty. They start to kind of buckle a little bit. All of those are signs that you need to act now. Don't rush them back to the chair. They're not going to make it. They're just not. Get them on the floor. So if I'm walking somebody and they're in front of me where they should be, and they start to get a little squirrely on me, as we're walking, because I'm in motion, as we're walking, this leg gets planted right in between theirs. This hand grabs the gait belt and I pull them against me. This is my position. I'm going to lower you to the floor and then we're going to see what's going on. 1, 2, 3, and we're lowering to the floor. Patients sitting on the floor can't fall on the floor. Whatever they pick up by sitting on the floor, we got soap and water that'll wash it right off. I can't wash off a broken hip with soap and water. Get them sitting on the floor. That will be a written test question. Number 1 wrong answer, rush them back to the chair. They're not going to make it. They're just not. Good? Okay. So here are our principles. Nothing new to learn. Except when we learned shoe rules, we only covered the first 2. We have to cover the rest of shoe rules to be able to understand how to do this skill. This is the last principle we have to learn. This is it. And you have now memorized everything on that back wall. Everything. So along the bottom here is your test-specific information. Somebody with your level of experience should be able to do this in 5 minutes or less. This is going to be done on a live testing student. They'll be sitting in a chair at the beginning of the skill. So that's how you're going to set this up. And we're going to learn the rest of shoe rules. So page 67 has our step-by-step instructions. We have a care plan at the top of the page. It says ambulate the resident at least 10 steps. Use a gait belt or transfer belt. Patient will be sitting in a chair at the side of the bed with shoes on. Patient is able to walk but needs assistance to stand. So this is our rock and roller, right? They need a little assistance to stand, but they can walk. When you are the patient for this, when you are the patient, you are going to receive specific instructions from the evaluator. They are going to tell you to walk like you walk. Do not turn into a 90-year-old invalid. Do not pretend to fall. Do not do anything weird. This is entry-level skills testing. And it's really important that you understand this because this is a standardized test. That means if somebody is testing in Miami and they get ambulate with a gait belt, and somebody is testing in Tampa and they get ambulate with a gait belt, and somebody is testing in Tallahassee and they get ambulating with a gait belt, it has to be the exact same test. Standardized testing. So walk like you walk. Don't turn into a Oscar-winning diva here. The only supplies we need are shoes, which patient already has on, and a gait belt. But that care plan says at least 10 steps for the test. They're going to give you a destination. They're going to say, walk to the table and back. Walk to the wall and back. They're going to give you a destination. You're going to follow the instructions. Guys, 10 steps means 5 steps in one direction and 5 steps back. So we're not walking far. This skill is not really about walking. It's about, are you paying attention to the patient while you're walking? Do you know how to stand them and sit them down? It's a super quick skill, but it really has nothing to do with walking. All right, so let's learn the rest of the steps that were the rest of the shoe rules that we need to do this skill. So to review, remember that if the patient's feet hit the floor, we got to talk about the shoes. Slipper socks are not enough. So in this case, your patient already has shoes on, but we want to mention it. I see you have shoes on. Are your shoes tied appropriately? Do your shoes fit well? Something that acknowledges that we know that that's important. They used to make us put the patient's shoes on for this skill. They cut that step to make the skill quicker and easier, but that doesn't mean that we don't have to tell them that we know that's important. Okay. So when you put a gait belt on a patient, this goes around their waist, not yours, theirs. But I'm going to show you on me. Okay, this goes around the patient's waist, but I'm just going to show you on me real quick. It does not matter whether the buckle faces this way or the buckle faces this way. Nobody cares. What matters is that the tag goes in like every other piece of clothing. When you put this around the patient's waist, you want to put it on so that it doesn't twist at all. It's got to be flat. So they're going to look for that. It's got to be flat, not twisted. When you get it around the patient's waist, oh, and it doesn't go up here. It's around the waist. When you get it around the waist, you're going to put the free end through the first guard by the alligator teeth. So Jake, can you zoom in for me? See if I can stay still enough. Okay, so let me move over a little bit so that, can you guys see? Okay, so we take the free end here and put it through the first guard by the alligator teeth. And we're going to pull the direction the teeth point. You see how those teeth are all pointing that way? We're going to pull this that way. If you try to pull it this way, it's not going to go anywhere. You want to pull it this way, and you need it snug. If it's too loose, it's going to go up underneath the breasts or under the arms, or the patient's going to fall out, so we want it snug. So we're going to pull this until it's snug. I only want to be able to fit 4 fingers between the belt and the patient. Once you've got it snug enough, we've got to lock it in place. So that free end now goes through the second guard right here. And then this end can hang down. If it's too long, we take this in and just tuck it into the belt. Now that we have the belt in place, we can use it to stand our patient. Take them for a walk, come back, and sit. To remove the belt, we're going to take it out through the second guard. Now, this is a little bit different. It's not a full reverse. Instead of pulling the belt, which we did when we put it on, this time we're going to pull the buckle. So we slide the buckle along the belt. Remember, to put it on, we pulled the belt. To take it off, we slide the buckle. Pull it off. Now, I want you to listen closely. We don't slide this off of the patient. Do you hear that? Hear that sound? That can cause skin tears, skin burns, injuries, and bruising. We don't pull it off. We're going to reach our hands around and take it, or you can loop it up and over. But if you do that, don't let this buckle hit your patient's head. It's better to use this up and over to remove it, but we don't slide it against the skin. Good? Everybody understand how to use this? I've got 2 of them up there. You'll be able to practice today. So when we put the gait belt on, we're going to check to make sure that it's snug enough by putting 4 fingers between the belt and the patient. Their feet have to be flat on the floor before standing. Now, I need you to focus on the floor for me, please.
Did we not set one up yet?
I don't think we set one up.
Nope, okay. We gotta get that default.
Okay. You see my feet? Okay, I'm short. Even though it looks like my feet are flat on the floor, they're not. In order for me to get my feet flat on the floor, because I've got short legs, I have to sit forward. Now my feet are flat on the floor. If you try to lift me to a standing position and my feet are not flat on the floor, my weight is going to move forward, and that's a fall risk. It's also a bad body mechanics risk for you and risk injury. So when you're going to lift a patient, you have to make sure their feet are flat on the floor. And to do that, we're going to verbally say, are your feet flat on the floor? Or can you scoot forward for me so that your feet are flat on the floor? Good. Now, I'm going to turn the chair sideways so you can see something real quick. Okay. So if my feet are flat on the floor here, you could draw a line right in front of my feet. Okay. A little bit hard to see. You could draw a line right in front of my feet, and you could draw a line on each side of the chair, and I would be sitting in a box. You guys see that? You could actually draw a box around where I'm sitting. We're going to use that box for body mechanics. Now, it used to be years ago, years and years ago, we used to train people when they were going to lift a patient to stand toe to toe, knee to knee. That kept their feet from sliding out. So if you've been in healthcare at all, you were probably trained to stand toe to toe and knee to knee. The problem with that is physics. There is a physics principle that states every action has an equal and opposite reaction. So if I am lifting a 150-pound individual and I am standing toe to toe, knee to knee, and I am lifting them toward me, that's 150 pounds of force that is coming my way that my back now has to mitigate. And that's going to set me up for back injuries. We don't stand toe to toe, knee to knee. So if we have a patient sitting in the chair and we have that box, imaginary box around them, we're going to use that box for the right body mechanics. I'm going to put this foot in front of their feet. That keeps their feet from coming out. This foot goes parallel to the chair. So I'm standing at the corner of the box, 1 foot along each side, and I'm going to bend at the knees, not the back. My legs are going to do the work here. I'm going to reach around to the back of the gait belt, and on the count of 3, we're going to stand 1, 2, 3. That keeps me steady. I'm not bearing that weight coming forward. It's better body mechanics. Good. Make sense? So those of you who have been in healthcare, this is going to be a change for you. Yeah, toe-to-toe, knee-to-knee is not good. But lifting a patient like that, we have to move them as a unit. And we want their cooperation when we move them as a unit. So when I stand a patient up, I'm going to count to 3. 1, 2, 3, stand. That way, whatever strength they do have, they can participate. You don't want to do things to a patient. We have to do things with a patient. Counting to 3 makes them a partner. So we're going to stand at that oblique angle for better stability. And do you see where my patient's hands are? On the shoulders. Because what happens if I don't have them lay their hands on my shoulders, what happens is when you're pulling on that gait belt, you're lifting this part of the patient. If my arms are at my sides, it ends up doing this. And we're not moving that patient as a unit. So by putting their hands, just resting their hands on your shoulders, not around your neck, just resting their hands on your shoulders, when you lift them, They move as a unit. And I'll show you a picture in just a minute of what it looks like when you don't. Once we get them standing, we're going to ask, are you dizzy? I want to know here, not over there. I want to know here. Are you dizzy? You feeling okay? Can we go for our walk? All right. When we return back to the chair after our walk, remember it's only 5 steps in one direction, 5 steps back. This is not a far distance. When we return them back to the chair, okay, they come back to the chair, we need to ask them to turn around. When they turn around, they've got to feel that chair behind them. If they don't feel that chair, they're going to stiffen up. Subconsciously, it's a reflex. If you don't know a chair is behind you, you aren't willing to sit. So this is what it would look like, okay? So if I've got somebody, we walked, I had them turn around, I'm the patient, and I ask them to sit, I have no idea if there's a chair behind me or not. I may have seen it, but I don't know how far behind me. I am not willing to back my butt up when I don't know if there's something there that's going to catch me. So when you turn a patient around, you have to ask them to back up so their knees hit that chair, and now you can help them to sit. That is important because more falls happen during the sitting phase. Because if they don't know that that chair is behind them, they don't trust you. Most patients have been dropped. They don't trust you. There's a reason during corporate building events, the trust fall is a trust thing. They don't trust you. They have no reason to. They have to know that chair is behind them. Otherwise, they're going to stiffen up and you're never going to get them to sit down and falls will happen. Good? Okay. So we're going to use proper mechanics when we lift. We're going to bend at the knees, not the waist. And we want to remove obstacles before we walk the patient. So during the test, I'm going to move over here. You're going to have to adjust, Jake. In fact, put me on follow me. Okay. So for the exam,
Come on now. Do the follow thing. Here we go.
there we go. It's not following.
Hold on, let me reset.
Hi.
Try again.
Okay.
Why is it not?
All right. Just,
Hold on. Go back real quick. Go back to center, please.
yeah, we're following the mannequin.
There we go.
We're still learning how to use the camera.
Why is it not?
Just bring it over here.
It won't rotate.
New plan. There we go. Okay, that's good. That's good. Okay, so during the test, the evaluator is going to have a patient sitting in the chair. And they're going to have something in your walkway. Remember I said they're going to tell you where to walk to? So if the evaluator says, I want you to walk to the table and back, it's because they have put something in that path. Your job is to identify that something is in your path and move it before you stand your patient up. They will do this. They will. Because what they want to make sure is that you're not going to leave a patient standing there while you leave and try to move something, which puts the patient at risk. Good? All right. So let me come back over here. Let's get through these slides. You're fine. You're fine. Leave it there. So gait belt, we're just going to review real quick, and I'm going to show you the scale. Gait belts go over clothing. We're going to hold the gait belt around the back or sides to lift. Don't lift from the front. Yeah. Their hands should be on your shoulders so they move as a unit. We're going to let the patient lead. We'll walk slightly behind and to one side, and we're going to monitor how they feel throughout the skill. We'll control the descent using the gait belt, and don't pull the gait belt across the body when removing. At the end, we'll check to make sure that the patient is seated properly as we do this. Oh, I guess I don't have the picture. In your book, can I borrow your book real quick? In your book, on page 61, at the top of the second column, you'll see a picture that shows what happens when you try to lift a patient. Do you see how their shoulders are back? This can actually cause falls to happen. So make sure their hands are on your shoulders. Questions? All right, let me get somebody to come sit in the chair for me. Thank you. All right, Jake, we're going to be going over that direction. Thank you. See if you can follow me with the camera, Jake.
I think it's going to be locking onto the mannequin either way.
Yeah, but see if you can follow me.
Oh, yeah.
All right, here we go. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you? Good. Do you feel like going for a little walk? Okay, I'm just going to move the obstacles, close your curtain, wash my hands, and I'll be right back. So I'm just going to get this out of the way. Close the curtain. Remember, after your first skill, you can simulate hand washing. My hands are clean. And I'll get the gait belt. All right, Ms. Jones. I see you have shoes on. Are your feet flat on the floor? Okay, I'm going to put this gait belt around you. This is going to help me lift you to a standing position and provide a little stability while we're walking, okay? So I'm just going to slide this around your waist. We're going to put it through the first guard by the alligator teeth. Go ahead and lean forward for me a little bit. There we go. Okay, we're going to get it snug. I only want to be able to fit 4 fingers. We'll lock it in place. And I'm just going to tuck this out of the way. Okay. I'm going to lift you to a standing position using the gait belt. You're going to put your hands on my shoulders in just a moment, and I'm going to count to 3. Okay, and then we'll stand. So 1 foot beside, 1 foot in front. Go ahead and put your hands up here, bending at the knees. 1, 2, 3. You feel that stability? Feeling okay? Are you dizzy at all? Okay, we're going to walk to the table at your pace. So I'll walk slightly behind, holding underneath. Good. Go ahead and turn around, and we'll walk back to the chair. Feeling okay? Okay, so turn around, back up so your knees hit the chair, and I'm going to help you sit. You're going to put your hands back on my shoulders, and we're going to sit the same way we stood. 1, 2, 3. So I'll remove the gait belt. Remember to take the gait belt off. You slide the buckle. Okay, go ahead and lift this hand up for me. There we go. Are you comfortable? Is there anything else I can get for you while I'm here? Let me get your call light. Here's your call light. If you need anything at all, just go ahead and press that red button, and I'll be happy to help you. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Your environment's clean. Bed is in the low position. I'm going to go put my gait belt away and open the curtain. Wash my hands. After washing my hands, I'll review my skill, make any corrections, and tell the evaluator my skill is done. Thank you. Questions? No? It's a pretty easy skill. I would want that skill.
Yeah.
I would want that skill. All right. Now we're moving on to the hard one. I spent the last 2.5 days
working on the new partial bed bath video. We did 3 different takes with the mannequin in 2 different positions and 2 different gowns, and I've lost an audio file. So this skill is very challenging for me right now. But I should have it up for you, the new video up for you, I would say probably by Wednesday afternoon or Thursday. I should have it up for you. But this one can be a little challenging. It is the longest skill we have. The longest skill. If you look down here, somebody with your level of experience should be able to do this in 19 minutes or less. It's a long skill. But I will say the good news is for the test, if you get this one, you get 2 super short skills to go with it. Respirations and range of motion. So it's not bad. It's a washing skill. We already know all the washing rules. Whatever we wash, we rinse. Whatever we rinse, we dry. We don't put soap in the basin. We check the water. They check the water. Yeah, I mean, there's nothing new to learn here. It's not a hard skill. But nobody wants it because it's so freaking long. So all of these principles are involved. That's a whole lot of checkpoints, guys. That's a whole lot of checkpoints. So cut yourself a little slack here. Whole lot of checkpoints. All right, page 127 at the top of the page, it's going to tell us our care plan. What do we know about the care plan? Do exactly what it says. So it tells us to give the resident a partial bed bath. Stop. Time out. Partial. What does partial mean? Don't look at the care plan. What does partial mean? Don't wash everything. So what parts do you think we should wash? There it is. Say it loud. Whatever the care plan says. If it says bed bath, that means we wash the whole body, top to bottom. If it says partial, that means that we're not washing the whole body. We have to know what to wash, and where do we go for that information? The care plan. Do you remember on day 1, I told you not to make friends on the testing in the testing center? You guys remember that? This was the biggest fight that broke out in a testing center, was over this skill. Because somebody said, well, with a partial bed bath, you have to wash all the dirty areas. You know, the face, the pits, and, the dangly bits. Right? Somebody else says, no, you only wash half of the body. Somebody else said, well, but you have to wash. They were absolutely in non-agreement over what needed to be washed with a partial bed bath. My student said, you wash whatever's on the care plan. And the whole place went, what? So there's 7 students testing that have no idea what a care plan is. That is why I live stream. That scenario is why I live stream. Because these people might get lucky and pass the test, but how effective are they going to be in a clinical workplace? They're going to be making up their own rules. That is why I live stream. So if it says partial bed bath, we have to read on to find out what we have to wash. It also tells us to provide a back rub. Now, we're not massage therapists, guys. That's not what this is. Yeah. All we're doing, do you remember when you were a kid and you were sick and mom came along, just kind of lightly rubbed your back and you felt better? Right? That's what this is. But if we give a little bit of a back rub, particularly from the base of the spine up to the shoulders in circles, what we're doing is stimulating blood flow. Because your patient is laying down. We got to stimulate, we got to wake up those blood vessels. And that's really what this is. It helps them feel good. It stimulates circulation. It's a good thing to do. So we're going to go on and find out what exactly we need to wash here. It says, wash the resident's face, neck, chest, abdomen, side,
it doesn't say, I'm sorry. Face, neck, chest, abdomen, back, and one arm and hand. Doesn't tell you which one. They don't care. One arm and hand. Do we wash the other one? No. It tells us with soap and water, so it tells us what to use. Now, that's actually important because in a hospital, we don't use soap and water anymore for bed baths. We do not use soap and water in a hospital for a bed bath. They have specialized packets, and the content, the solution in those packets actually provides a barrier on the surface of the skin against pathogens. It's really cool. Remember, hospitals are pathogen-rich environments, so this provides an extra barrier layer. So in a hospital, we would not be using soap and water. The care plan would reflect that. But here we are, soap and water. Provide a brief back rub with lotion. Dress the resident in a clean hospital gown after bathing. Patient is lying on back and center of bed and can roll as directed, but is too weak to assist with bathing. So we can ask the patient to move around however we need to. She's a mannequin. She's not going to. We're going to have to move her, but we can ask her to. There's not much here to learn, really. We're going to wash the face first. No soap on the face. We don't want soap on the face. It dries the skin. It gets into the eyes. So face first, no soap. So we have a final principle that we haven't talked about. Now, we've learned washing rules, but I kind of skipped over this one and said, we'll get to that later. Well, it's now later. So let's learn about using the leaves method for wet body openings. Okay. Take one and pass it out, please. Take one and pass them out. All right, those of you who are playing along at home, go get a washcloth. Just a plain square washcloth that you have laying around your house, wherever it is. Plain square washcloth, because we're going to learn how to use this. And it's not the way you think. So let's review washing rules real quick. We don't add soap to the basin because whatever we wash, we have to rinse. If you add soap to the basin, we get rid of our rinsing water. We're going to use a paper towel to turn the water on. We're going to check the water, make sure it's warm, not hot, not cold. This is just a review of the washing rules that we've learned so far. And the patient has to check it too. We're going to change the water if it gets cold or soapy. And whatever we wash, we rinse. Whatever we rinse, we dry. Nothing new here. Dry surfaces have to remain dry. That's why we use a barrier. That's why we're going to put a towel on the bed under where we're washing, because we don't want to get those sheets wet. And then finally, when we put lotion on, we warm it at first. We wipe off the excess. So let's learn about this leaves method thing. So if we have a plain square washcloth, you guys all have these at home. If you fold it in half and in half again, it makes a little square. You guys, this is how we fold them in the, linen closet. But instead of looking at it as a square, I want you to look at it as a diamond. And if you put this in your hand with the free ends facing up, not this folded, not this side. I want the free ends facing up. I'm going to tuck one side of the diamond between my pinky and ring finger. I'm going to tuck the other side of the diamond between my thumb and index finger. So this is what it looks like on the back. This allows me to wash some body part, and then I can fold this over and trap the contamination underneath and gives me a new cleaning surface. I'm going to wipe something else. I'm going to fold that over, trapping the contamination underneath, giving me a new cleaning surface. I can wipe something else and fold it over. I can wipe something else and fold it over. And I can even use the backside to wipe something else. This is called the leaves method because we're using the leaves of the washcloth, just like that. Make sense? Okay. Now, if I'm just washing skin, I don't need this. I just use it as a washcloth, right? But if I'm going to wash a wet body opening, do you remember when we learned on class 2 about gloves and we learned about the chain of infection? Portals of exit let things out, but they also are portals of entry that lets things in. You guys remember that? Okay. So if I'm going to wash a wet body opening or a doorway, I've got to be careful not to spread anything that comes out of that doorway around or let anything into that doorway. So think about what we learned on class 2. What are our doorways? Eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, and incisions. So if I'm going to wash around any of those things, I need the leaves method. If I'm just washing regular skin, I don't. Regular skin, it's just a washcloth. Wet body openings needs the leaves method. So when you have this washcloth in your hand and we clean something, we fold that over and we're going to hold it with our thumb. Once we fold it over, we hold it with our thumb. And this helps keep that contamination confined, just like what you see here. So we fold it over, we're going to hold it with our thumb. We're going to clean something with leaf 2, fold it over, and clean something with leaf 3 and fold it over. Clean something with leaf 4 and fold it over, and then the back side we can clean something with as well, if we need to. Don't have to, but if we need to. So I have 5 independent surfaces on this one washcloth. Guys, if you have little kids, you will use this with your little kids more than you use it in healthcare. This is amazing. I think all parents should know this. So let's review the care plan one more time. It says, give the resident a partial bed bath and back rub. Wash the resident's face, neck, chest, abdomen, back, and one arm and hand with soap and water. Provide a brief back rub with lotion. Dress the resident in a clean hospital gown. Patient is lying on back in center of bed, can roll as directed, but is too weak to assist with bathing. So here are all of the steps that we need to remember when we do this particular skill. So these are skill-specific steps. We're going to wash the face first, no soap, because you don't want soap in the eyes. So water only. And then whatever we rinse, we dry. So we'll wash the face just with water and then we'll dry it. We're going to use the leaves method with any wet body opening. That's what we just learned. And we're going to make sure we wring those washcloths out thoroughly. No drippy, wet washcloths. We want to wring them out and then we'll apply soap directly to the washcloths. When we're done, we'll set the washcloths on the barrier. So you should have your clean supplies on one side and then anything used should go in a different area. Don't put them on your clean supplies. Put them on the barrier. Don't put them on the floor. Don't put them back in the basin. Now, the one exception to this, anything you apply soap to gets set aside. Anything that touches a wet body opening gets set aside. But a rinsing washcloth that just touched intact skin, a rinsing washcloth can be reused because we would apply soap to it on the next step. Rinsing washcloths can be reused. Now, you can do this simply by just having 5 washcloths. One for the face, one to wash the front, one to rinse the front, one to wash the back, one to rinse the back, 5 washcloths. Makes it easy. But I'm going to show you how to do it with 4. Because wherever you go to work, chances are you are not going to have the level of supplies that you need to work efficiently. And that's a sad reality. A lot of CNAs go in, grab all the supplies they need for their patients for that shift, and they hoard. Other facilities simply don't have enough supplies to go around because they're cheap. I have to prepare you for the realities. So I'm going to teach you how to do this with 4 washcloths. But if you've got 5, go crazy. Use 5. The rinsing washcloth from the front can be reused to clean the back. Okay? That's how we can cut it down to 4. Now, if it touches a wet body opening, it can't be reused. If you apply soap to it, it can't be reused. But you can reuse a rinsing one. We'll wash, rinse, and dry the back, and then we'll give a brief back rub for circulation and comfort. And we're going to warm that lotion first. We'll warm the lotion up first. Once we give the back rub, then we'll wipe the excess lotion off. Then we can change the gown. Now, it doesn't matter when you change a gown. Again, I'm all about time efficiency. So when I get the front done, remember, we're only washing one arm and hand, right? So when I get the front done, face, neck, chest, abdomen, one arm and hand, wash, rinse, dry, I change the gown then. Take the old one off, put the new one on, scoot the patient towards you, flip them on their side, wash, rinse, dry the back, give them the back rub. And now all I have to do is tie that gown. It's already done. If you don't do that, if you wash, rinse, dry the front, scoot them, turn them, wash, rinse, dry the back, you got to get them back on their back in the middle of the bed, change the gown, scoot them towards you, flip them up, tie the gown, put them down, scoot them back to the middle. It's a whole lot of effort for the patient and a whole lot of time wasted for you.
They don't wear a gown because I know some places they can wear like their own pajamas. Is that
So,
new ones on?
okay, so for this skill, we're going to go by our care plan, and our care plan tells us gown. So we're just going to put a gown on. But in a clinical setting, yeah, you would, whatever the norm is for that patient or whatever the care plan indicates or whatever the case may be. But you're going to dress in a way that makes it efficient for you. Look for efficiency. And I'm going to approach this differently with every patient. I can't give you one answer that's going to work on everybody, unfortunately. But let's say that I have this lady. We'll just pick on her, right? This lady. And after I bathe her, I'm going to put her in a pullover shirt and a pair of sweatpants. Okay. And I'm only going to give her a partial bed bath. So like, whatever the care plan just told us to. So when I do that, I'm going to have to clean her back, and then I'm going to have to sit her up to put the pullover shirt on. And then I would put the pants on and the socks. So it really depends on what is needed for that patient. Now, if I were to bathe somebody that's able to sit on the side of the bed, I'm going to bathe that person a little bit differently, right? I'm going to start at the top and just go down. So every situation is going to be a little bit different. Does that make sense? I can't give you one answer, unfortunately, that's going to cover everything. But yeah, we do. We put normal clothes, civilian clothes on patients all the time. But if you've got a patient who is incontinent and bedbound, in most cases, we're going to have something that has easy access because we're going to be changing them and cleaning them frequently. Remember that we get our barrier first before we get our supplies, and then we'll put all of the supplies on the barrier. We're going to fill the basin and ask the patient to check the water temperature. We'll protect the sheets with a towel during bathing. They're going to need a privacy blanket. We're going to use gloves, but the first thing those gloves should touch is the patient. So we're going to do all of our prep work first here, guys. Once you've got your gloves on, we're going to wash the face first, no soap, and we'll start with the eyes, inner to outer corner, fold your leaf. Go to the other eye, inner to outer corner, fold your leaf. Third leaf is just going to wash the rest of the skin of the face. The last leaf will wash the nose. I do the nose last, boogers. You don't want to spread those all over. Whatever we rinse, we dry. So we'll control the towel and dry all of those surfaces. We'll wash, rinse, and dry the torso, one arm and hand. I don't care how you do this. Nobody cares how you do this. Wash what's on the care plan. But I wash the armpit last because, ew.
Even if
What? Even if what?
it tells you, if it doesn't say it on the thing, wouldn't that be considered common courtesy?
Well, the care plan probably isn't going to tell you when to wash the armpit. That's going to be up to you. I wash the armpit last. Yeah. Change the gown. Support the elbow when you lift the arm to change the gown. Turn them on their side. Wash, rinse, dry the back. Give a brief back rub with lotion. Tie the gown and put her back on her back in the middle of the bed. Now, you have gloves on. You got all kinds of dirty stuff on your table that we've got to take care of and put in a hamper. You have to have gloves on to handle the dirty stuff. Your patient is laying in bed, covered, safe. Remember I said, this is going to be the hardest part of doing these skills. You're going to want to take that privacy blanket off of her and pull that sheet up. You're going to want to. Should you? No, because you need your gloves on to take care of all of this. So we're going to take care of our linens, put them in the hamper. We're going to clean our basin, put it back in the drawer, and then take our gloves off. Then we can take the privacy blanket off and pull the sheet up. You guys remember, that's going to be your hard part. I'm telling you, you're going to struggle with this. I know you're looking at me like, I know you've said that a million times. I'm not going to struggle with that. When you get up to practice, you're going to struggle with that. So we'll clean our basin, collect the supplies, put them in the drawer, remove your gloves, and then take your bath blanket off. Then you can do your closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Here's your call light. Let me open the curtain. Go wash my hands. Then you can make any corrections and tell the evaluator your skill is done. Good. Oh, it's a long skill. They give you 19 minutes to do this skill. Thankfully, the video only takes 12. Let's go ahead and show you the video for this one. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves.
Miss Jones, let me go get some water. I'll be right back. Miss Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown. And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Miss Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Miss Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this sleeve over to prevent contamination from spreading to the other eye. Miss Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinsed washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. Go ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Miss Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Miss Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, and we'll soap the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out, and we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please, and scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin. and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded. And now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done.
No? Okay, so we're almost done with skills. We have a couple skills we're going to learn on Wednesday, including pericare. And then we have some skills that we're going to learn next Monday, which is going to be catheter care, drainage bag, bedpan, toileting skills. And that's it. That's it. And nothing new to learn. So now we're just going to learn how to apply everything we've learned to these new skills. So the hard part is now behind you. It gets easier from this point on. Any questions? All right, let me have Jake go ahead and pass out your review sheets to you. You have one chapter of homework tonight. It's another skills chapter, chapter 7. Just go through the paragraphs in between the skills and take the test. Write down any questions that you have. Does anybody have anything else I can help you with? Class going okay for everybody? Anybody overwhelmed? A little bit? Okay, see me after class and I'll see what I can do to help. All right, the rest of the class is simply practice. I have nothing more to go over with you. I'll go ahead and sign off online and then you guys can practice ambulating, denture care. We've got everything is here. All of the supplies are here. Everything is here for you. Okay. So those of you that are joining us live online, thank you so much for tuning in. We will be back on Wednesday for class 6. Oh my goodness. Wow. It's going so fast. We'll be back Wednesday for class 6. Stay tuned later on this week. I should have partial bed bath up. I will be retaping it. I'm going to put this one up. It's good for now, but I will definitely be redoing this one because it's not what I'm looking for. So, but it is better than what I have. So it's all good. If you have any questions, please feel free to leave them in the chat. You can also email me. If you go to flcnatraining.com, my email address is at the top. Anything I can do to help. Until next time, guys, happy caregiving. Bye.